खुशी यहाँ इधर बैठ जाओ, दूसरा होगा इस तरफ इसको नहीं। मृणाल, YouTube हो गया? Okay. Good afternoon. This is GV Srinivas, Ambassador speaking from our embassy in Muscat. And as usual, as you know, this is. Please mute yourself यार. मृणाल जरा बंद करो सबको भाई. सब पता नहीं कौन को चला देता बीच बीच में. Mute all. Hayat International was on the line. Everybody may kindly keep yourself muted and wait for me to invite you. Thank you very much. As I was saying, nobody to push presentation because we'll call you. ये कहाँ से आ रहा है? अच्छा ठीक है ठीक है ठीक है. Our Ministry of Health, absolutely fine. Sorry. So I was saying that this is a series of these online interactions which we have been organizing for the past 15 days or so. And today we will be talking about healthcare and medical devices. The format is known, but let me repeat. First, we will be inviting the Oman aggregators. Aggregators include the ministries, chambers of commerce, export promotion agencies, etc. Then we call the Indian aggregators. Again, the ministry and then the aggregators of chambers, export promotion council, etc. These aggregators get a maximum of 3 minutes to make their point. 3 minutes may appear to be too limiting, but to be very frank, it is not that much because anything that you have in detail about the profile or the statistics, you can send to us as a PowerPoint or as a lucid note, which we upload on our portal and everybody gets to read them. The 3 minutes which the aggregators get may focus exactly on how you look at the bilateral corridor. The same thing will happen with the company level, first beginning with Omani, then Indian, in which case they get 1 minute. Again, the same principle of what exactly you see as an opportunity, how you wish to move forward. Let me again repeat, anything more detailed, PowerPoint full, all lucid notes, any backgrounder, please do email to us and we will be including them in the notice that we had circulated through which you participated here. We had done that in the past. We not only upload there, but we also do that AI ragging. Ragging is retrieval augmented generation. So all the information that we received is easily debugged through proper AI support, etc. So that's the basic support that we provide. Once again, let me invite first through my colleague Sonia here.
Ms. Balkis Al-Makhiri from Director of Investment and from Ministry of Health, and Engineer Faiza Al-Jajjali, Director of Medical Device Department, again in Ministry of Health.
So we had two colleagues from Oman taking the floor. Balkis,
Thank you.
beginning with you.
Thank you so much, Your Excellency. Thank you for having this presentation again.
Go ahead, Balkis. Floor is yours.
Sure. And also here with me, Engineer Faiza, which is the Director of Medical Devices in the Drug Safety Center. I'll just share my presentation. Just 1 minute. Okay. My presentation is clear?
Yes, very clear. Go ahead.
Thank you, Your Excellency. So talking about the healthcare investment in Oman, this presentation prepared by the Department of Investment Empowerment. We empower the investors in the healthcare through different pillars, whether it is manufacturing or private health institution or digital technology using in the healthcare. When we talk about Oman, we are talking about the area, the coastline, the population is 5.2, 56% are Omanis, the working population reaching to 2.7 million. The currency is the third strongest currency globally. Quality of life, we're reaching fourth globally, first in Asia, and the safety, we ranked sixth safest globally through the safety index. When we talk about the population, we talk about the healthy life expectancy at birth. We are targeted to be 70 years by 2040. And when we talk about the National Survey of Non-Communicable Diseases of the year 2025, we can see the percentage of overweight and obesity, 64%, high cholesterol reaching to 30%, high blood pressure, 28%, diabetes reaching 13.4%, and tobacco 17.1%. All these pillars is requiring more medications, more healthcare institutions, and taking care of the populations. When we talk about the health workforce and the health sector up to 2024, we are reaching almost 72,000 healthcare personnel into different criteria, and we are reaching 13.4 doctors per 10,000 through our population. Beside, Oman is a strategic location for the investors to come and to build their investment hub in Oman. We have a very robust economic growth in Oman that is projected at increasing to be 22% GDP since 2019. The foreign direct investment inflow is reaching 11.9 billion USD in 2024, and we have a strong credit rating, maintaining a stable investment grade status through different institutions. When we talk about the strategic location, we are talking about the seamless global access for the healthcare investors through the trade agreement with Europe, with the USA, with the GCC, with the Great Arab, and recently with the India, through the CEPA agreements, and the Asian with the Singapore. So all of these are access to the re-export market for you to come and to build your investment in Oman. When we talk about the accessibility, we have 5 airports, we have 7 major ports, 30% of the world population within 3 hours flights, and we are 8th globally for the road quality, and that all will build the leading pharma and medtech hub in Oman. When we talk about the zone, we have a different zone in Oman that is targeted for the investment-free zone with its own incentive, and industrial areas with its own incentives and advantages, and the economic cities also. And here it shows the location of these zone and the total investment in each zone. And these are some of the specific incentives toward doing your investment in Oman: corporate tax exemption, free zone tax holiday, import and export duties, some of the custom exemptions, and also the real estate, the subsidies, the land lease, and the leasing term, the grace periods. All of them are advancing the investors and attracting the investors to come and to build their business in Oman. And the sector specific incentives, we have major two. We have an offtake agreements with a local manufacturer in Oman through the drug or through the medical supplies up to 30%. And we have up to 30% also price preference when these local manufacturers are bidding to the tender of MOH. This one is only for MOH tendering. We're not talking about the medical city of university. We're not talking about the medical city of military services, and we are not talking about the private sector. The cost competitive advantage for the healthcare investors is another advantages to attract investors in Oman. The ICV, the fast track visa, the investor protection through the foreign capital investment law, and the stable financial system, as I mentioned earlier, one-stop approvals through Invest Oman, low cost of doing businesses comparing to other markets, the tax zone, the integrated infrastructure, and the healthcare professionals that exist already in Oman that is reaching more than 71K. The Oman healthcare spending at glance, MOH spent 2.5 billion USD, and the spending breakdown of the government to the private, the government is taking the lead of 85%, whether beside the private, which is 14.7%, and these numbers about the export and re-export and the import to Oman. The strategic role in Ministry of Health, we have an 8 different strategic program. One of the main program is pharmaceutical economics and the drug security strengthening program, in which all the objectives are supporting this strategic role of MOH. When we're talking about Oman pharma sector, we're talking about the investment here. 95% of our needs, we import it from outside. 5% only we are localized here in Oman. The government priority products to be localized in Oman: vaccines, chronic disease, injectable medication, specialty formulations, and raw materials. When we talk about the Oman medical devices, which is today's concern, the investment opportunities, medical equipment, the advanced medical devices, the specialized materials, all of them we are targeting. 97.2 of the lab supplies is imported, and 92 the surgical items is imported through the MOH tendering. So the opportunity is there for you guys to come and to build your hub in Oman. Investment project in the medical industries. 32% are foreign investment, 1,000 approximate job created, and 2,000 products locally manufactured here in Oman. We have a 20 existing manufacture, and we have 18 projects under construction and implementation through medications, supplies, and the raw material. Oman Hospital and private, and this is some glimpse of of other investments that we are targeting for Oman Digital Healthcare and the PPP project. We are done one for the rehabilitation for drug addiction in Sohar, which was a PPP project. Now there are another project on the pipeline under consideration: diagnostic services, private room project at the Royal Hospital, reduced production project, and establishment of health technology company. That the healthcare investment in Oman is transformative, and we have some examples of strategic investment that's happening in our country. OIH is one of the example. Nexa, wearable AI for the productions, is another local transformative case study that we are proud of. Felix Pharma, pharmaceutical manufacturing in Salalah, is another investment. For other details, we are welcoming to contact us directly through our department WhatsApp or through email, and this is our address. And all the information that the investor will need. MOH website is down the left side. MOH procurement, there's a detailed of how much the ministry spent from 2021 to 2025 through the medication and through the supplies, and all of these materials and quantity and the value. So you will have an overview of what we are buying and from whom we are buying and what is specification that we are requiring. And then Oman Pharma Cluster, where to build your investment in. There's a lot of information, a lot of incentives in each area. Investors guide that we build in our department. It shows all the details that I have mentioned. MOH annual report to build your feasibility study, and frequently asked questions for all the questions generally from commercially down there to the healthcare and the investment. Thank you so much, Your Excellency. Thank you.
Thank you, Bilkis. Thank you very much. Your colleague
welcome.
from the medical devices, would he want to take the floor now?
Faiza, Engineer Faiza.
Thank you, Bilkis. Is
You're
your
welcome.
colleague from medical devices segment be taking the floor? No? No.
Okay.
Next.
Yeah. And now we will invite Dr. Poonam Meena, Director International Cooperation, Ministry of Health, India.
So Ministry of Health India has a series of presentations. I would request Poonam that each presentation be maximum for 3 minutes. I think 3 of your colleagues are covering 3 different aspects of the cooperation as you see for India and Oman. So Poonam, the floor is yours. Go ahead.
Thank you, sir. Good afternoon, sir.
afternoon.
My name is Dr. Poonam Meena. I'm a director in the international cooperation in the Ministry of Health and Family Welfare from Government of India. I would like to apprise the participants that we have a MOU with the Ministry of Health in the Sultanate of Oman in the field of the healthcare cooperation which was signed in the 2018. And under this MOU, we have already 2 meetings has been conducted. And this is the one prospectus. Now I request my colleague, Ms. Reena Ashish Das, Director E-Health, to present her presentation on digital health, the agenda for today. So over to you, ma'am.
Digital health representative. Yeah, we have.
Good afternoon, sir. This is Reena Ashish
Good
Das.
afternoon.
I'm looking after digital health in Ministry of Health, Government of India. I just wish to give you a brief overview of the digital tools or the digital applications which we are using in Ministry of Health at present. So India has a very
Reena,
ambitious.
first make your presentation full screen. That will be helpful. Make it full screen, please. Correct. I think that to the right. To the right further. नहीं ये नहीं है ना right का एक और right. Same spot. Same belt underneath. क्या कर रहे हैं यार? Correct. Very good. Go ahead, Rina. Excellent.
Good afternoon, sir. Sir, I
Okay.
just wish to give you a brief overview of the digital health applications or the digital health tools which we are using in Ministry of Health, Government of India. Sir, we have a very ambitious digital health vision, and we are leveraging the digital health public infrastructure to advance our universal health coverage by ensuring the accessible, affordable, and quality healthcare for all of our citizens. Sir, these are some of the key focus areas in our plan. Is we have adopted a national digital health ecosystem under Ayushman Bharat Digital Mission, and we are maintaining our longitudinal electronic health records. We have established a pan India telemedicine network, and we have established three centers of excellence for artificial intelligence, and we have developed some cyber security, some tools, innovative tools for cyber security, etc. Sir, I would like to brief you about e-Sanjeevani. This is a national telemedicine service, and it's a flagship program of Government of India. This platform delivers the healthcare services across urban, rural, and the remotest possible region of India. It works in two modules, sir. One is the AB arm and the other is e-Sanjeevani OPD. AB arm is a provider to provider specialist consultation. The CHO or the junior doctor consult the patient through this mode to the expert doctor. And sir, through e-Sanjeevani OPD, it is a patient to provider consultation, sir. It's a virtual consultation. The patient can download the app, and he or she can himself connect with the doctor. And this second module is it's very useful for the people who are not not residing in the mainstream or some facility. They are in the remotest location, and we have very good results for from this teleconsultation platform, sir. We have completed more than 38 crore consultations till date. Sir, its outcome is that we can ensure the continuity of care, and it reduced the geographical barriers. And we have also used certain AI tools in this, like symptom catcher CDSS. The second initiative is that, sir, we have developed a next gen e-hospital, that is an HMIS, and it has enabled the paperless and the interoperable healthcare management system to us. And it has various modules, more than 16 modules we have developed, and we are in the process of developing further modules as well. But some of the key modules are registration, emergency, OPD, IPD management, e-prescription, laboratory and radiology system, billing, pharmacy, and inventory, sir. Sir, we have established a dedicated in-house team for the artificial intelligence healthcare tools, and we have set up three centers of excellence in different parts of India, in AIMS New Delhi, AIMS Rishikesh, and PGI Chandigarh. And we have developed certain tools, and we have deployed as well, and we are further progressing in development of further AI tools, sir. And we are signatory of SOMED CT standards, and we are using these standards for creating our digital health records. These standards helps us in interoperability of the records and standardization of our digital or clinical documents, data-driven healthcare delivery, and seamless patient care continuity. These are few of the initiatives, sir, which I have highlighted. We are working on various other key initiatives. So if if the time permits, then we can connect further and we can share that, sir. Thank you so much.
Sonia, who is next?
Miss Akanksha Ranjan, Director MOH again in India on healthcare workforce.
Healthcare workforce related presentation by Akanksha, Director, Ministry of Health. Akanksha, are you there?
Good afternoon, everyone. Good afternoon,
Yeah.
sir.
Good afternoon. Good afternoon.
Sir, India and Oman, shall I start? Oh, I think that's not
Yes,
on
go
full
ahead. Your
screen.
presentation is visible. Go ahead.
Okay. So, India and Oman has already a strong, long-standing relationship and already an MOU as informed by Director International Cooperation, Ministry of Health. So India has a strong healthcare workforce. Courtesy, it's a strong emphasis on public healthcare systems and significant investments in public healthcare systems. Our HRH policy also focuses on strengthening the workforce, improving syllabus, and improving the quality of workforce. India has more than 1 million registered doctors, more than 4 million registered nurses. And the areas of cooperation that, next slide. So the Indian regulators that India has recently implemented a lot of changes in the regulatory frameworks and nursing, Indian Nursing, National Nursing and Midwifery Commission, National Dental Commission, National Medical Commission Acts have all come up, and the regulatory framework has been updated and made in consonance with the global standards. India's healthcare workforce training is also, most of the syllabuses are in as par with the global standards. Next slide, please. So, the possible partnership avenues that we are exploring is exchange program for healthcare professionals, wherein cross-cultural learning and educator programs can be explored. Then mutual harmonization and recognition of competencies, which also in due course helps in facilitation of workforce mobility. The regulators in both countries can come together and discuss upon the syllabus harmonization and mutual recognition agreements for syllabus. This has already been in place for some other countries, and there is also dual degree programs that are in place for nursing students. The other area of cooperation can be joint training and capacity building programs. So India can help in capacity building, and as well as we can learn from each other in the healthcare partnerships. And then for establishing a partnership, we can have the regulators sit together, we can have inputs from Oman on the requirements of the healthcare workforce, requirements of mobility, what kind of course harmonization requirements would be there. So this will help in understanding how we take forward that relationship. Thank you.
Thank you very much. Next, Sonia, who do we invite?
Mr. Praveen Kumar Mittal, Executive Director, Export Promotion Council of Medical Devices.
Good afternoon, Ambassador. I hope I'm audible, and thank you so much
Yes,
for
you are. Good afternoon. Go ahead.
Yeah, so we are the Export Promotion Council for Medical Devices. We have a short presentation. Next slide, please. So as we all know, universal, healthcare is a universal right. And so with this, we wanted to open our presentation. Next slide. Total medical devices market currently is about $18 to $20 billion in India, out of which about $4 billion is the exports. We are growing at almost about 15%. And if I talk about the number of countries, almost about 180 plus countries is where we are exporting these medical devices to. Next slide. Workforce, and of course, what we're looking at is reaching a $30 billion market by about 2030, and the exports rising up to about $10 billion. Next slide. These are representative of our industry. The Indian companies are actually manufacturing here, exporting to the world, and precisely almost all of them are here on this call with us. Next slide. This is a representative company list wherein right from consumables to disposables, cardiorespiratory, radiology and imaging devices, implants, IVs, almost about everything under the medical devices segment, as we have the 4 classes risk-based classification. We are manufacturing everything in India. And thanks to Government of India, we have 3 medical devices parks. Up north is coming next to the new international airport at UP, which is the Noida International Airport, which is the medical devices park YEDA. Then we have at Kanchipuram, which is Tamil Nadu, the south of India, and we have in the central part, part of our country, which is at Madhya Pradesh next to Jain. So these three medical devices parks are going to manufacture critical care devices, and not just for looking at domestic consumption, but also exporting it to the world. Next slide. So if I talk about the medtech manufacturing, this is the snapshot of our current manufacturing categories, and there are selected beneficiaries which are supported by Government of India under the PLI scheme, which is the production level. Next slide. So that's the infrastructure in our country for healthcare, wherein we have 54,000 plus hospitals, which are public and private combined, 4.2 million nursing staff, 1.3 million allied healthcare staff, hospital beds almost about 1.3 million, allopathic doctors about 1.4 million. And overall, in about past 5 years, what we've seen from 2019 to 2024, almost about 52,784 medical visas were issued for Omani nationals to come and take treatment in India. We are looking at $30 billion market size by 2030 at a growth rate of about 15% CAGR. If I talk about the exports from India to Oman, there has been a slight dip from 14.91 million. We have dropped down to about 13.432 million, and I think now with this India-Oman SEPA getting into operation, we see a good traction and business relationship there. Next slide. If I quickly come on to the healthcare facts for Oman, there is a high dependence on Western imports. The healthcare infrastructure definitely needs to be looked into. And we're looking at developing supply chain from India to Oman. And then, of course, not just within Oman, servicing GCC and also look at the African markets jointly. Next slide. The SEPA will definitely is going to play a catalyst role in terms of creating collaboration in the healthcare value chain between Oman and India. Next slide. We're looking at servicing, not just GCC, but Africa, as I shared with you. And we will also want to, develop Oman as a regional medtech hub for the region. There are various from distribution to contract manufacturing in India. Then, of course, looking at, complete value chain and looking at joint ventures that brings in a good value proposition for both Oman as well as for India. So if at the end of the day, we are all looking at servicing human life, and wherein quality is, of a lot of importance. So right from CDSU approvals, we also have all the companies which are present here today are having US FDA certification, C certification, which is the European certification. All the necessary certifications are in place, and we look forward to working very closely with the Oman Regulatory Authority and also look at regulatory harmonization, which needs to be looked into from both Indian as well as the Oman side. Next slide. If I talk about competitive edge, of course, quality and affordability. My next slide will actually tell you the price differentiation which we bring on table. Next slide. So we almost bring down the cost for medical devices by almost about 30 to 40%. If I take a case in point, the diagnostic equipments, which from the West, in case if you were importing for about $1,400, what India would export about to bringing in percent or 42% of savings to about $800 dollars, and similar for the other categories. And these are all realistic data. In fact, I also wanted to brief the House here today that we are next looking at the India MedTech Expo, which is a Government of India program organized by the Export Promotion Council for Medical Devices. It would take place from the 14th to the 17th of January. The last edition in 2025, which happened in the month of September from 4th to the 6th, we had a sizable presence of Oman delegation. We look forward to an Oman delegation this time as well. wherein we would like to invite the Ministry of Health officials, the regulators, and of course the procurement agencies and the importers from Oman. Even the investors and people who are looking at joint ventures and collaboration will work closely with our Indian embassy in Oman to look at potential participants here. But this is something which is a flagship program for India. And as I shared with you, 14th to the 16th of January is when we organize it at the Greater Noida Expo Center, which is also next to the Noida International Airport, and where the new medical devices park of about 350 acres is coming in. So I think with this, I would, these are our contact details. I'm Praveen Kumar Mittal and I head the council, but we work very closely with our and look forward to working with you on site. Thank you so much.
Thank you. Thank you very much. I will now invite Rajesh Narayanan. He is from Oman Investment Bank, dealing with the commercial arm of it, but he will also talk how powerful they become with the other sister part, which is the investment banking arm of the Oman Investment Bank. So, 1 minute, Rajesh, whatever you want to say, or entice our industry on the two sides.
Thank you so much, Mr. Srinivas. Thank you all for hearing me out. My name is Rajesh Narayanan. I represent the Oman Investment Bank. I'm sure that our Oman colleagues on call would have heard about us and would have interacted. But nice to have the Indian fantastic clients as well over here. So Oman Investment Bank is a 2-year young bank. We got our license in 2024. It is, to just give a flavor of it, it is the only and 100% owned bank by the government of Oman. It comes under OIA, Oman Investment Authority. As a bank, we are very clearly meant for the Vision 2040. That's the purpose and objective of our existence and the way forward. We have been granted 2 licenses, which is a commercial banking license, which I take care of, which takes care on the transaction banking business and all types of dealing with corporates, banks, financial institutions, treasury, and facilitating the flows and the loans and trade finance and other stuffs. And the other arm is the investment banking license. We are the only bank in the entire Oman to have a license of an investment banking. The investment banking has got 2 parts. One is advisory services, which basically means that any corporate who is required to get into any kind of investment into Oman or anywhere globally in terms of and wants advisory services of setting up right from a brick and mortar stage to the execution stage and run like an RFP of a meaningful size, we are happy to be called up, and we have got a team of over 27 investment bankers who come with an average of 20 years plus experience and having their expertise on various fields, including real estate, metals, mining, and other activities as well. So we will get the right expertise, right partners for investment. So we do not invest on our own, but we have global investors to facilitate the right meaningful activities. The second part of the investment banking is the markets and the trading. Markets is especially if corporates are requiring for raising long-term financing in terms of bonds, in terms of equity raising, in terms of IPOs. We are happy to facilitate and partner with that because we deal with global investors from that perspective. In a short window of 2 years since we got a license in April 2024, we have roughly around 85 corporates onboarded. We have roughly around 42 banks, and we offer around 13 currencies across. Um, our focused areas of strategy reason why we are focused is GCC. We are very highly driven on Central Asia, which is very unlikely in this part of the world, and also Africa. We also heavily focus on India and China. So to my prospective clients in India and in Oman, we will be happy to facilitate any kind of a banking assistance in terms of the corridors to be met, because we ourselves work very closely with the government, and you surely will be getting the comfort of a sovereign bank. So from that perspective, anything which is required, happy to support, happy to have a conversation and do business with you. So I would share my coordinates with the team, and if anyone could be interested, can reach out personally to me, and happy to support. Thank you so much.
Thank you, Rajesh. And also to reiterate, please do send whatever you said in the nature of a PowerPoint or a backgrounder for the larger understanding of the companies as to the services that you can offer to the prospective Indian investors predominantly in any of the zones in Oman. So hopefully you'll be sending that. It will be much more easier for us to grasp the services, particularly investment arm through advisory and market, which is referred to. Insightful presentation will be helpful. Thank you very much once again, Rajesh, and Oman Investment Bank. Thank you.
Mr. Darshan Shah, Chairman of Pharma Task Force, Gujarat Chamber of Commerce and Industry.
Gujarat Chamber of Commerce and Industry. Okay, next.
Yeah, hello.
Mr. Ishan Pandita.
Okay, go ahead. Make it full screen. Gujarat Chamber.
Hello.
Correct. Go ahead.
Audible?
Yeah, audible. Speak couple of lines before I can confirm. Say
Okay,
something.
sir. Good afternoon.
Good
Hello.
afternoon. Good
Hello.
afternoon.
Yes, yes, sir. Good afternoon, everyone. Good afternoon, sir. Today we will. May I start, sir?
Yes.
Okay. Today we will discuss briefly about the
3 minutes. Okay. 3 minutes maximum. Thank you.
Opportunities emerging for the pharma industry through the India and Oman Comprehensive Economic Partnership Agreement that we call it CEPA. This agreement is expected to strengthen the trade and economic relation between the India and Oman while creating new opportunities for industry and specifically for the pharma. For India and particularly Gujarat, this is an important development because our pharma industry has already strong capabilities in manufacturing, quality standards, and exports. The CEPA can help pharma companies to improve market access, uh, strengthen the regional partnership, and export to Oman and wider GCC region. Uh, Moving forward, why Oman is important for the pharma industry? Oman is becoming an important for market.
Darshan,
Yes,
you
sir.
may have forgotten to unmute your video. Just a suggestion in case you want to show your face. We'll all love to see.
Sorry,
Otherwise,
sir.
continue.
Pardon. So sorry, sir.
No problem.
Now,
Anybody, I'll request yeah, go ahead, continue speaking.
yeah,
Others also, as they speak, please do unmute your video. Now
thank
it
you
is
so
much
much.
better. Now we see you also. Go ahead, continue.
Thank you, thank you, thank you. Oman is becoming an important market for the Indian pharma companies due to the steady growth of its healthcare sector and rising demand for medicines and healthcare products. The country is investing heavily in the healthcare infrastructure, hospitals, and medical services while continuing to depend on largely on the imported industry product health products. India is already has a strong global presence for supplying the affordable and highly quality generic medicines, APIs, as well as the formulations, which making by Indian companies highly competitive in the Omani market. Oman's strategic location also makes it a gateway to the wider GCC and Middle East region, supported by the strong port connectivity and logistic infrastructure. Uh, I will see key benefits of CEPA for pharmaceutical industry. The India-Oman CEPA can significantly enhance the export opportunities for the Indian pharma industry by reducing trade barriers and simplifying the business procedures. This will help pharma companies to export products between the Indian manufacturers and the Omani distributor or the healthcare companies. For Indian exporter, this create better opportunities for APIs, as I already said, the formulation and specifically medicines for some specific disease and the healthcare products. Oman can also serve as a strategic gateway for expanding into the wider GCC region. Overall, SIPA can create a more business-friendly environment and support long-term growth for the pharma sector. How benefit of Gujarat pharmaceutical industry can Oman have? Gujarat is the one of the India's leading pharma manufacturing hubs and major contributor to the pharma export. The state has a strong ecosystem of API manufacturer, formulations company, specialty pharma units, as I already said, and packaging industry and export-oriented business supported by globally compliant manufacturing standards. MSMEs also play an important role with the many companies engaged in export and specifically contract manufacturing services. With the strong manufacturing capabilities, experienced exporter, and excellent port infrastructure, Gujarat is well positioning to benefit the India-Oman SIPA. Let me conclude this. India and Oman SIPA can become important growth driver for the pharma industry by the strengthening the bilateral trade, improving market access, and creating new opportunities in the Oman and wider GCC region. For Gujarat, it is strong pharma ecosystem. The agreement can support export, business expansion, and international partnership. At the same time, industry must focus on quality standard, export readiness, regulatory compliances, and the global competitiveness. With active industry participation from our end and the supportive policy from your end, the SIPA can further strengthen India's position as a trusted global healthcare and pharma sector. This was my presentation. Thank you so much for your time and attention.
Thank you, Darshan Shah.
Thank you.
Mr. Ishan Pandita, Director, FICCI Healthcare.
Good afternoon, Ambassador.
Good afternoon.
We will just take you all through a few of the slides on behalf of FICCI. FICCI has a very active medical value travel and pharma and medical device committee. We worked on all aspects of health as a super sector. There are a couple of slides which I want to take you through. Next slide important because pharma has already been addressed in yesterday's meeting, Ambassador sir. Just giving you glimpses, FICCI is one of the oldest and apex chamber of India, constituted in 1927. We represent more than 250 thousand companies, 250,000 companies nationally. This is our leadership. Next. One of the important sectors which are being covered and which will immensely benefit India-Oman relation in the recently signed SEPA agreement, sir, is the collaboration that we can have in the field of medical value travel. Already 15% of the entire tourists who are coming from Oman are coming for the medical treatment purpose. Many of the hospitals in India, they already have a collaboration with existing hospitals in Oman and various medical associations in Oman. The indicative list is mentioned here, highlighted here. These are all hospitals who are also members of our medical value travel committee, and in case any Omani representatives would like us to connect with them, we'll be happy to do and facilitate that. Why India has been chosen as a preferred medical value destination, sir? As you all know, it's high quality and care, advanced technology. You have heard about medical devices from Praveenji. We are one of the growing sectors of medical technology adopted by the hospitals. We have great set of doctors. There's a cultural familiarity between India and Oman, and we also have a diverse speaking populations, and Arab speaking support is also being provided by various hospitals. Next. as far as a few takeaways that we have culled out of India-Oman SEPA, sir, is one, the medical value travel. It will further enhance our collaboration between two countries. There will be exchange programs which will also happen where doctors from Oman will travel to India, get themselves equipped with the latest state of the art technology which Indian hospitals are providing. Many of the patients will find it easy from Oman to come to India for their treatment. Corporations in terms of capacity building and standardization, harmonization will is also being proposed. Uh, Pharmaceutical, we already covered. Pharmaceutical approvals will help us in providing generics and latest of pharmaceutical products to Oman. Acceptance in terms of certifications like GMP will further enhance our cooperation in business. Important sector which is being covered this time in SEPA is, sir, the formal recognition of Ayush, Indian Ayush system, which would help us in getting the products, Ayush products being accessible and available in Omani market. It will also help our Ayush doctors to come and practice in Oman. And we can also expect many of the Omani population coming to India to get themselves treated with the best Ayush practice that is available in India. Next. So these are some of the expected impacts in a positive side, which are we are expecting uh, between Oman, India, and Oman SEPA healthcare sector. As I just mentioned, medical tourism is going to get enhanced. We will have enhanced export opportunities in pharmaceutical sector, health research and collaboration between two countries in training and standard alignment will be enhanced. Uh, Growth of telemedicine, digital health platforms, and cross-border healthcare services will also be, will also have a large impact, and it will enhance as we speak. Faster market access and also expanded international acceptance and commercial opportunity for Ayush products and services in both countries. Next. My colleagues from Government of India Ministry of Health have already explained that, but these are some of the government initiatives which are already in existence, and it will give us an opportunity to further have a deeper collaboration with Oman under these important initiatives. PLI, Ayushman Bharat, e-Sanjeevani. uh, we have skill development and in healthcare capacity building program, here in India initiative. So these are all government-led initiatives where we think that we could have a further collaboration with India and Oman as we go forward. Next. Talking about FICCI's leadership events in health domain, especially in the field of medical collaboration and export of services in healthcare, we have a lead flagship event called Advantage Healthcare India. It is one of the biggest and largest program on medical value travel. This event is eighth edition old. The ninth edition is scheduled for January 2027 in Delhi. Again, we have got immense response from Omani counterparts in our previous editions. We would love to have a business delegation and governmental delegation from Oman coming and being a part of this important initiative. It is being supported by Department of Commerce through their market access initiative. Uh, we're also trying to build up one business delegation to Oman. We're expecting it to be, commence in the month of September or October, for which we will be in touch uh, with with Embassy of Oman in India and also Indian Embassy in Oman. So we look forward to have your collaboration and involvement in both the initiatives. And in case you have any further inquiries related to Ayush medical value travel, we'll be more than happy to assist you in FICCI. Thank you so much. So
Thank you, Ishan.
I
Thank
just
you very much.
chat box. this is the coordinates that I have. Thank you so much.
Thank you, Ishan Pandita from FICCI.
Mr. Chanakya, Chairman Chemical Committee, Gujarat Chamber of Commerce and Industry.
Gujarat Chamber,
Yeah,
Chanakya.
Yes, sir.
am I audible?
Yes,
Good afternoon, sir. Good afternoon, everyone.
good afternoon.
One second. Is it visible? The slide is visible?
Presently a blank screen.
Yeah, one second, one second. Can you give me a moment, please? I'll just come back to you. I'll just resolve this. I don't know why it's not.
Try to move the slide up and down. Yeah, it is visible now. Make it full screen.
Yeah. Okay. Yeah, done?
Correct. Go ahead.
Yeah. Good afternoon, everyone. On behalf of the GCCI Chemical Committee, I am pleased to share our perspective on the proposed India-Oman SEPA and the opportunities it can create for Gujarat's chemical industry. Gujarat has been the chemical manufacturing hub of India for so long time. With increasing global trade partnerships, this agreement can open new avenues for exports, investments, and collaboration. Why Gujarat leads India's chemical ecosystem? The state contributes significantly to India's chemical production and exports. We have a strong industrial clusters such as Ankleshwar, Vapi, Dahej, Ahmedabad, Bharuch. This ecosystem includes petrochemicals, specialty chemicals, dyes, intermediates, agrochemicals, and of course pharmaceutical intermediates. One of Gujarat's biggest advantages is its strong port connectivity and industrial infrastructure, which supports global trade and export efficiently. The strong industrial foundation positions Gujarat very well to benefit from international trade agreements like the India-Oman SEPA agreement. The India-Oman SEPA is a comprehensive economic partnership agreement aimed to strengthen bilateral trade and investment relations between two countries. The agreement is expected to improve market access, reduce trade barriers, encourage investments, enhance logistics and supply chain connectivity, create new opportunities for exporters and manufacturers. Oman also serves as a strategic gateway to the GCC region and African markets. For Indian industries, especially chemical, this agreement can help expand international presence and diversify export destinations. The SEPA can also help industries reduce dependency to the limited markets and encourage barrier export diversification. Opportunities for small chemical units. There have been many small, medium manufacturers located in India and of course Gujarat and India. Many small, medium, and chemical manufacturing Gujarat have strong product capabilities but limited international market access or exposure. Through SEPA, MSMEs can be benefited from easier export opportunities, new distributor and buyer connections, better participation in international supply chains, technology and business collaborations, increased visibility in Middle East markets. However, awareness and export readiness will be very important. For that, where institutes like GCCI can play a major role in guiding and supporting such industries. Uh, while the opportunities are promising, industry also has certain expectations for effective implementation. Some important expectations include simplified export customs procedures, faster approvals and documentation systems, mutual recognition of standards and certifications, better, better logistics and shipping connectivity, financial and export support for MSME, stable and uh, predictable policy environment. The industry also expect continued support from sustainability initiatives and green chemical transition. To maximize the benefit of SEPA, collaboration between government, industry association and business will be essential. The Oman SEPA has the potential to become a significant growth catalyst for Gujarat's chemical industry. With Gujarat's manufacturing strength, export capability, and entrepreneurial ecosystem, we are well positioned to take advantage of emerging international opportunities. The key will be collaboration between industry, government, and trade institutes. On behalf of GCCI Chemical Committee, we look forward to contribute actively towards the journey of growth, global outreach, and industrial development. Thank you very much.
Thank you very much. Thank you, GCCI
Thank you.
and Chanakya ji.
Thank you.
Thank you.
Thank you, sir.
Now we will start with Omani companies, sir. So first is Mr. Abdul Latif, Managing Director of Badr Al Sama Hospital.
Latif bhai ho? Abdul Latif.
Yes, Excellency, I am here. Can you hear
Oh,
me?
very good. Go ahead. Floor is yours, Abdul.
Yeah. Good afternoon, Excellency, and all the
afternoon.
dignitaries from Oman and
afternoon.
India as well. So it is a good opportunity to talk in front of everyone. So, mashallah, from the Oman side and Indian Minister of Health side, we are seeing the slides and all. So it is interesting. I don't have any slide and all. But as a person last 25 years in Oman, I can share my experience with this platform. So it is Oman is one of the really very business friendly country. I have started 25 years back in this healthcare industry. I started one single unit hospital. Now I have 14 hospitals across Oman. Per day we are seeing 10 to 11,000 patients we are seeing. And the same time, I have business in Bahrain, Saudi, and similar type of around 36 units are outside. But my head office and everything is in Oman. Because it is a very business friendly country and it's a geographically, and I think it is a gateway, as everyone told, gateway to the GCC and the Middle East, and very business friendly country. And as a member of Oman Chamber of Commerce and Industry, as a elected expert member, so through the FICI and all, I seen their presentation and all. It is really interesting. If anyone want to establish any business, healthcare business, there is a very good opportunity. When I start first branch, after that I start 14 branch. Another more than 25 big hospitals and healthcare group also they came, they started here. So everybody is doing well. So India and Oman have very good relation for healthcare. In India also have hospitals. The most of the Omani nationals are depending Indian hospitals and India for their further higher treatment. So in this SEPA collaboration, I think we can exchange our experts and the professionals, and we can start high-end surgeries and all here like robotic surgery and advanced type of surgeries all. So now is the really time. So anybody want to invest in Oman, from the Oman Chamber of Commerce as a board member, and I am the head of the Foreign Investment Committee in Oman Chamber of Commerce. So I can support in any manner. Even FICCI also coming, I heard that in September, FICCI also they are planning to come. So we can also support to FICCI, Oman Chamber of Commerce also we can support to make a collaboration with the FICCI and all. So it is a really very good initiative, His Excellency. And I'm thanking for all, and I'm wishing all the success for this event. Thank you.
Thank you, Latif, for sharing your success story in Oman and also adding that many have actually followed you and also doing equally thumping business and also referring to the new areas like robotic surgery, etc., which hold a lot of promise. Hope that our companies are listening to you to see how to take this forward. Thank you very much.
Thank you. Thank you, Excellency.
Thank you.
Mr. VMA Hakim from Hakim Medical LLC.
Hakim?
Mr. Sachin Sharma from Oman Pharmaceutical Company.
Sachin,
I'm there.
go ahead.
Good afternoon, His Excellency. I have a small
Good afternoon.
presentation to share.
Yeah.
Is it
Make sure
visible,
you
sir?
finish it in 1 minute. Huh? Sachin, don't mind.
Yeah,
but
yeah. I'll quickly
this
finish
session.
it.
You have to go back.
Welcome everyone.
Very good.
Yeah.
So,
So,
please
with over 20 years of experience and presence across 45 countries, Oman Pharmaceutical Products Company is one of the largest and a global pharmaceutical company from Oman. We have presence across 45 countries with our business model, which is branded generic business, contract research manufacturing services, and strategic partnership. We have a research and development facility in Ahmedabad. We have corporate office in Muscat, manufacturing plant in Salalah, and we have scientific office in Ivory Coast, as well as Riyadh, Saudi Arabia. We have over 30 regulatory accreditations worldwide, starting from America and Europe, where we have US FDA, Health Canada, and Visa Brazil, MHRA UK, BZB Hamburg, and so on, followed by several regulatory accreditations from Middle East and Africa, as well as from Asia and Australia. We basically operate through three major business models. Zynova, which is our branded generic arm. Through this model, we operate in the businesses of Middle East, Africa, and Asia. Through contract research and manufacturing services, we operate in mainly Europe. And we have another business through which we operate in the United States of America. And we have 3 filed ANDAs in USA, along with a lot of pipelines products as well. Coming to our manufacturing capability, we have a capability of over 600 capsules, 2.5 billion tablets, 19.5 million bottles, and 26 million topical tubes annually. We are also a research-focused company with R&D facility in Ahmedabad, Sanand, with the development formulations, analytical development, reverse engineering, tech transfer, as well as packaging development. As I said, we have 4 approved ANDAs and few more ANDAs in pipeline, and over 1,000 registrations globally. We across a lot of therapeutic coverage with anti-infectives, anti-inflammatory hormones, GIT, respiratory, derma, and so on. Now the strategic partnership we are looking for both for pharma businesses as well as the medical devices businesses. We are coming up with the help of Ministry of Health Oman. We are coming up with the injectable facility, with the plant should be ready by next year. So we are looking for sterile API and sterile bulk powder for injections. And the proposed business model will be that we will be filling, packaging, and commercializing our new injectable facilities from Salalah. So we are looking currently for cephalosporin 3rd generation and 4th generations, beta-lactam cephalosporins ready to fill powders. Other than that, we also have a requirement for strategic partnership for in-licensing the ophthalmic business in Middle East. Currently in the Middle East, in Oman, there is no manufacturing for ophthalmology plant. This is where we are looking for a next set of opportunities. And specifically for the medical device sector, we are looking for opportunities for meter dose inhalers, nasal sprays to be launched in Oman. So I think somebody else shared the presentation. I missed my part.
Yeah, I think the one who has just added the presentation may kindly wait for a while and stop that. Mrinal, any way to remove that and come back, Dr. Rajiv? Yeah, Razi, yeah, thank you very much. Back to you, Zainova.
Yeah, so thank you everyone, and we are looking for a strong partnership with Indian partners. We have roots back in India as well. We are a global pharmaceutical company supplying to 45 countries. We have a state-of-art manufacturing plant which is approved by US FDA, MHRA, UK, along with 30 other global regulatory accreditations. And this is our credentials. You can reach out to us for further details. We will be actively seeking partners for cephalosporins injectables, as well as ophthalmology and respiratory devices. Thank you, everyone. Thank you, His Excellency.
Okay. Thank you very much. Very good presentation. Really compliment you. You directly alluded to many of the opportunities which exist in Oman. I think everybody who has heard you has taken good note of it. Let's see if any of those opportunities get tied up. Thank you very much.
Thank you very much, sir. Thank you. Thanks.
Thank you. Thank
A representative from Arabian Medical Devices.
you. Arabian Medical Devices.
Very
Mr.
good evening.
Gopa Kumar. Yeah, he's there.
Arabian Medical Devices.
Good evening, sir. This is Muhammad from Arabian Medical Devices.
Go ahead, Mohammed.
I'm representing Arabian Medical Devices in place of Mr. Joy as he's traveling. So we are serving the Sultan since last 18 years in the field of orthopedic, medical sutures, consumables, and we are looking for opportunity to have some collaboration in orthodontics, ophthalmology, and ortho. So we are happy to serve the country of Oman. Thank you. Currently, I don't have any kind of presentation with me.
No, good enough, Mohammed. You indicated your area of interest. Thank you very much.
Mr. Gopa Kumar from Al Hayat Hospital.
Yeah, Gopa Kumar.
No, Your Excellency.
Good afternoon.
Yeah, good afternoon. I'll just share my presentation.
Yep.
So thank you for giving this opportunity to Al Hayat Hospital for sharing this presentation and speaking about the hospital. 1 second as it loads up.
Yeah, make it full screen. Good. Go ahead. 1 minute. Thank you.
Okay, so we are a hospital, 35-bedded hospital, which is situated in Gubra in the Sultanate of Oman. We have been operating in this Sultanate from 1995 as a standalone hospital, and we have 35 plus in-house specialists and consultants and 15 visiting consultants. We have even doctors from India and from many international communities, mainly the Arabian countries as well. So it started in 1995 as a single cardiology clinic, which was owned and run by Dr. K.P. Raman, who was the first cardiologist to work in a private hospital way back then. And then that got converted into a multi-specialty hospital in 2012 in Gubra, where it is now. And presently we have 2 clinics also, which is situated in Muscat area, one in Gubra and one in Al Hil, which is about 20 kilometers away from Gubra. This is just the owners of the hospital, just to introduce them, and the top management. And our aim and vision is to provide quality healthcare to all the people who visit the hospital, whether you are from Oman or whether you are from the GCC or from anywhere in the world. So these are the different departments that we have. We have a center of excellence mainly in the cardiology unit, which deals with interventional cardiology as well, orthopedics, internal medicine, diabetology, women and health, gastroenterology, and ENT. with other specialties like dentistry, neurology, anesthesia, general surgery, rheumatology, pulmonology, physiotherapy. We also cater to Visa Medical and OQ Medical and PDO Medical. The Cardiology Center of Excellence also deals with all these facilities which are available. We have got a team of 6 cardiologists. The orthopedic center has been manned by 5 doctors. We have 2 Indian doctors and 3 Arab doctors. There are spine surgery which are also being done by the hospital through the 2 visiting doctors. We have an internal medicine, endocrinology and diabetic centers of excellence which are manned by 4 doctors, and 2 of them are Indian and 2 of them are in the Arab population. Gastroenterology is manned by 2 visiting consultants from the Sultanate. Obstetrics and gynecology is manned by 5 doctors, 1 Indian doctor and 4 Arab doctors. The pediatric department is manned by 2 Indian doctors. ENT is manned by 2 Arab doctors. Urology is also manned by 2 Arab doctors. These are the major insurance players that we cater to from the global market. These are our contact details for the Polyclinic and the Visa Medical and Ahale Clinic. We offer all these services there 24/7, 365. We are also having ISO certificates which are updated, as well as the current NABHI accreditation also. Thank you very much, and we hope that this platform will help develop, foster better relationship between Oman and India. Thank you very much.
Thank you very much, Mr. Gopkumar from Al Hayat International Hospital. Thank you.
Mr. Abu Bakr Jawaz, Royal Medical Equipments.
Abu Bakr, Royal.
Thank you, sir. Thank you for giving the opportunity. Abu Bakr from Royal Medical.
Can you unmute your video if you have?
Sir, I am in the. Is it possible? Can I continue on the voice, sir?
Okay,
If
continue.
you allow.
Yeah, go ahead.
Yes, sir. We are the medical supplier for the respiratory care products in Oman for a decade. So we are looking opportunities for the sleep medicines, sleep machines, which are supplied to us through the brand companies from the US and Australian brands. So we are looking any initiative will be done in the India, because many of our buyers, our hospital are keen for Indian product manufacturing of this kind of machines, especially oxygen machines, the sleep machines. These are the machines. This is a capability in the India market. They can manufacture and supply. Presently, we are getting this everything from the US machine, US, Chinese, as well as the medical equipment, which are very basic need. There are equipments like they for hospital, the end user. These products we are not getting from the India. We are getting very limited supply for the disposable. So we request and also through your this seminar, so Indian manufacturers can make the equipment for sleep medicines. So this is my specialty. Once again, thank you for giving me the opportunity. And thank you, Sonia ma'am, for having us. Thank you.
Thank you, Abu Bakr. Thank you very much.
Mr. Mohammed from Muscat Pharmacy.
Mohammed, Muscat Pharmacy.
Hello, yes, good afternoon, sir. Good afternoon to everyone.
Good afternoon.
Yeah, my name is Mohammed. I work for Muscat Pharmacy. I'm a VP of
Mohammed?
MedTech.
Maybe you would want to unmute your video, or you also want to be only voice. Yeah, good. Continue.
Yes, sir. Would I like to share the screen? Yes, sir. So I represent MedTech. I'm the VP of MedTech division in Muscat Pharmacy. We are into
Mohammed,
this
make your
business.
PowerPoint full screen. Mohammed, make it full screen, please.
Yes, I will do
Correct.
that, sir.
1 minute. Go ahead.
Yeah. So I represent Muscat Pharmacy MedTech division, where we have from the MedTech division we have got the surgical division, surgical consumables, medical devices, medical engineering products, and hospital furnitures, laboratory product line. So we are into this market over 57 years, and we serve Oman for both the ministry and the private market for the healthcare requirement. So this is our area of coverage. We are into the pharmaceutical distribution. We are into pharmaceutical retail outlets, and we do have the consumer product distribution line as well. And MedTech is one of the division in Muscat Pharmacy. And this is a small glimpse about Muscat Pharmacy. We do have 1,500 employees, includes engineers, pharmacists, assistant pharmacists, and we do have well set up warehouses for the cold chain management. And we do have more than 1,500 or over 300 principals for all the major product lines for the pharmaceutical consumer product line and for the medtech. And we do have the full fleet of 110 vehicles with 125 drivers. This is basically for the distribution product line. And when it comes to the distribution partners, we do have we represent almost from every single country the products from all over the world for the health requirement in Oman. And we represent for surgical and disposable principles. These are our one of the major companies we have in our surgical and disposable companies, starting from Ethicon, Abbott, Olympus, Stereomoca, Cook, Intersurgical, and so on. And these are the medical engineering principal companies. We represent GE for the critical care product line, and Siemens for the imaging and the radiology. And we have got all these product line for the medical engineering devices and for the hospital furnitures. Apart from this, we do have the medical gas pipeline division also. This is to cater the requirement from the healthcare segment. And these are the laboratory companies we represent already. We distribute the laboratory supplies to Ministry of Health and all government institutions and for the private hospitals and laboratories. And these are the major companies we represent for the laboratory product line. So this is very short presentation from us. To reach us, this is our website, and we have got social media connectivity as well to get in touch with us, sir.
Thank you, Mohammed Safiullah.
For any more information, please let us know. We are here to support you for any healthcare.
Thank you, Mohammed from Muscat Pharmacy. Thank you very much.
Mr. Damit from Lalan, Middle East.
Amit.
Yes, hi. Good afternoon, Your Excellency.
Good afternoon.
Is my slides clear?
Yes, very clear. Go ahead, 1 minute. Thank you.
Okay, so good afternoon to everybody. I just want to take you all through some of the things about us. So I'm from Lalan, Middle East, and basically we are in medical devices in terms of the gloves. And we started in Oman in 2019. And now we have a medical device facility here in Oman, where we cover in terms of clean room facility for packaging under class 8, ETO sterilization, microbiology lab, and medical warehousing. So the opportunity is actually we are in the SOHA free zone in the medical cluster and already established and also certified under ISO requirements with the GMP and Ministry of Health accreditations as well. The idea is that we are using Oman as a hub in terms of reaching the GCC and GAFTA countries along with the USA as well. These are our certifications. And the opportunity that we have is to collaborate and see for any sort of company looking to enter Oman to use our facilities in terms of white labeling or third-party sort of sterilization usages and all, and then scale up in terms of manufacture and enter the market as a made in Oman product. So I just put my details there for your reference. If there's any opportunities, we'd like to get in touch with you. Thank you.
Thank you, Damit. Thank you very much.
Mr. Sachin Agarwal from Al Hashar Pharmacy.
Sachin Agarwal.
Good afternoon, Excellency. On behalf of Mr. Sachin Agrawal, on Al Hashar Pharmacy, I would like to extend our sincere gratitude for the opportunity to participate in this innovative session. So Al Hashar Pharmacy, we are a leading distributor of pharmaceutical and medical devices in Sultanate with more than 5 decades of excellence in the patient care. Your Excellency, we see significant opportunities in the areas of surgical consumables, basic lab equipments, hospital furnitures, particularly in OT range, and the robotic solutions. We are actively seeking manufacturers who can collaborate with us in these ranges. We strongly believe that Indian manufacturers can provide efficient and competitive solutions, both in the terms of quality and delivery timelines. We look forward to exploring avenues of collaboration that will strengthen the healthcare infrastructure and enhance patient care in Oman. Thank you, His Excellency.
Thank you. Thank you very much.
Mr. Afas Yusuf, Riyada International Medical Solution.
Riyada, no? Something? Okay, next.
Next, Mr. Satish, Head of Penicillin G Pharma.
Satish Penji.
Yeah. Mr.
Hi, good
Tariq
afternoon,
from Connect
Excellency.
Oman. Oh, yeah, he's there.
Yeah, Penji, go ahead.
Yeah, good afternoon, Excellency, and good afternoon, team. Yeah, yesterday actually our team had the big presentation and everything. So we already presented this one. We are not in the this medical devices and all, but however we are representing here our major sourcing and everything is depending on the India. So we look forward to that one, India and as well as the Oman to strategic partnership. And we are more depending on our entire technologies and that healthcare related to equipment purchases and all, everything we depends on the India. So that is our strategic sourcing places too. So we look forward to the coordination between Oman and India partnership. Thank you.
Thank you, Penji. Thank you very much.
Mr. Tariq from Connect Oman.
Connect Oman. Tariq. Connect Oman.
Hi, Your Excellency. Can you hear me?
Hi. Yes, we can. Go ahead.
Okay, thank you very much for this opportunity. It's always an honor to see you and meet you, even online. So I'm Tariq from Connect. We are the event organizers, and I'm happy to present you from here, from Oman Convention and Exhibition Center. This is another example of how Oman is really a safe place to run exhibitions and events in the country. I just want to share with you the slide, or let's say the post-show report of Oman Health Expo, the subject of today's presentation. So what I'm presenting today is an event that has been held for many years, long-standing event dedicated for healthcare. And this year going to be in its 15th edition. Oman Health Exhibition is run and hosted by Ministry of Health in collaboration with various other healthcare institutions in Oman. Also, the exhibition is a very good example of a long-standing relationship between India and Oman in the healthcare sector. Since the inauguration of the first edition of Oman Health, we have an Indian pavilion that has grown in the years. Just to briefly, last edition we had 5,124 visits with 106 exhibitors spanning on 2,605 square meters. We are aiming to expand for this year by adding more medical service providers to the exhibition. Last edition, we had these brands exhibiting with us, and they are all famous in their segments and their sectors. But it's very important to highlight here our collaboration with the various directorates of the Health Ministry of Health. We're talking here about talking about as well the SMEs and the Drug Safety Center, in addition to the Quality Control Center and Pharmaceutical Center. Big names have been with us last edition, and we continue to form a strong relationship with these brands. Although the event has been known for being medical tourism driven, however, taking the trends in the country of Oman, where there is more focus on investment attraction and to increase manufacturing capacity in the pharmaceutical and medical device segment, in addition, of course, to medical services providers, we are shifting our focus in collaboration with our government partners as well as our international partners to include and welcome more manufacturers and investors in this segment. However, we continue to provide the link between let's say the one who are seeking medical treatment in foreign countries and the providers from those countries, and here we're referring to India in particular. Last year we had around 60 medical institutions exhibiting with us, and we look forward to increase the presence of India in the 2025-26 edition, in addition to the manufacturers. I look forward to have more brands and names exhibiting with us. The event is composed of various segments, but for this edition, we're going to have two sections, one dedicated for medical tourism, and the other segment is dedicated for pharmaceuticals. But we continue to promote Oman as a destination for medical tourism, and this opens opportunities for healthcare providers in India to come to the country and establish joint ventures with local healthcare providers. And there are many examples already operating in the country on this scale. I don't want to take much from your time, but the event, though it is a local event dedicated to Oman, but we continue to have more of some of the international visitors coming from Saudi Arabia and neighboring countries. That's in brief. I will be happy to discuss any details with any interested party to exhibit at the event. I just want to share with yourself my contact details. I'm trying to avoid having it as a sales pitch here. So this is my contact detail and my colleague as well. We are happy to respond to you, answer all your questions. Again, we are proud of the partnership with the Embassy of India, and we continue to collaborate, and we hope to see many of you coming as exhibitors, as visitors as well. Thank you very much.
Thank you very much, Tariq, and particularly for drawing attention of Team India to this event which you have in September. Hopefully, many will be warming up to that idea and participating. Thank you very much.
Looking
Mr.
forward.
Hashim Al Jabri.
Thanks, Tariq.
Yeah, Mr. Hashim Al Jabri from Medical Tourism.
Hashim Al Jabri, Medical Tourism.
So now we'll start the Indian company, sir. So first I will call Dr. Rajiv AG, Senior Consultant, Site Care Hospital.
Rajiv, Sitcom Hospital.
Mr. Ajay George, Bipa Drug Laboratories
Hello,
Private
sir.
Limited. Yeah, Rajiv. Sir.
राजीव थोड़ा लेट हो गए आप, चलिए बोलिए कहाँ से आपने बुला रहा था नाम आपका? राजीव, go ahead.
Sir, I'm from Bangalore, Site Care Hospitals, a unit of Omega Hospitals. I'm sorry that I'm not able to share my PPT due to some technical errors here. I'm very sorry on that. If allowed, I will continue with my presentation, please.
Yeah, go ahead. 1 minute.
Thank you very much,
Go
sir.
ahead.
Thank you very much. I'm Dr. Rajiv, consultant oncologist, radiation oncologist from Site Care Hospitals, Bangalore, a unit of Omega Hospital Groups. Site Care Hospital was founded in 2016 in Bangalore. Since a decade, we have been getting mostly into the oncology fraternity. We are a 150 bed located Bangalore, very in the close vicinity of the Bangalore airport. With the motto of your right way to health, we have been in partnering with the NCCN, ESMO, NHS, and ICMR for the protocol-based multidisciplinary treatment for in terms of oncology. The main focus of site care hospitals is the organ-specific treatments for the patients. We have been in the field of radiation oncology, medical oncology, and the surgical oncology with the utmost advanced diagnostic setup with the facilities of digital PET scan, mammography, MRI, and the CT scan. We have been treating about 45,000 patients with 50 plus countries and more than 60,000 radiotherapy fractions delivered, and more than up to close to about 50,000 chemotherapy infusions, with close to about 10,000 surgeries we have treated till now. And we are the first hospital who catered CAR T patient for an international patient in the hospital. So we're first in India to deliver so. With the facilities for the international patients, until now we have treated about 2,800 patients who come far away from Yemen, Bangladesh, Kenya, Iraq, Oman, Nigeria, Maldives, and New Zealand, Sudan. We have done about 10,000 patients for the international chemotherapy infusion for the patients, with about close to about 10,000 radiotherapy fractions with SRS, SRT, VMAT, IGRT, IMRTs. As I told again, the first CAR T international patient for India, we had delivered it in site care hospitals. And what makes the big difference for the patients, for the international patients, especially in India, is that we have the multilinguistic people who are available here. The patient who can speak the Arabic and the Bengali patients, Bengali for the Bangladeshi patients. We have a multi-cuisine restaurant which is available with the pick-up and drop facilities for the patients who are there, who come from abroad, and also the closer vicinity to from the airport. We are just about 3.5 to 4 kilometers from the airport, so that makes it very accessible for the patients here. And we have service apartments very close by located, which makes the patients very comfortable on here. The unique focus of us to specify again is that we are organ based, and we are very clear on the international guidelines and on par with the international guidelines for the treatment here. So looking forward on for the catering the Omanis and the GCC nations for the international care. Thank you very much.
Thank you, Dr. Rajiv. Thank you.
Mr. Abhishek Mittal from Allengers.
Now we are calling actually the members of the Medical Devices Export Promotion Council. Thank you for your patience to be listening in. We just began the presentation from the Indian companies, but we are giving the floor to the Medical Devices Association members. There are 18 of them joining us on the call, but 6 want to take the floor. 1 minute, please, so that we finish on time and do not delay it unduly. So first is again, repeat.
First is Mr. Abhishek Mittal from Allengers.
Abhishek Mittal.
Hello.
Next.
Hello.
Yeah,
Good
yeah.
afternoon.
Go
Everyone.
ahead.
Yeah,
Show
good
your
afternoon,
video.
everyone.
Yeah, good. Yes, we can see you.
Yeah, thank you, sir. Thank you, sir, for giving me the opportunity. My name is Abhishek Mittal, and I'm from Allengers Medical System Limited. I am the sales manager. I am looking Africa and the Middle East Africa region. Allengers Medical System Limited is one of the India's leading manufacturers of medical diagnostic and healthcare equipment company. The company was established in 1987 by our respected chairman, Mr. Suresh Sharma. Since then, company has built a strong reputation for innovation, quality, and reliable customer support in the healthcare industry. Our company manufacturing a wide range of medical equipment that includes digital X-ray machines, cath lab machines, C-arms, fluoroscopy, mammography system, 2D and 3D, digital radio fluoro, 3D dental X-ray machines, holmium laser. Apart from that, we do also manufacture some cardiac and neuropsychiatric equipments, that is EEG, EMG, ECG, patient monitor, and the TMT machines. With our advanced manufacturing facilities and a strong R&D team, we continuously focus on developing technologically advanced and cost-effective healthcare solutions. As of now, our equipments are installed in more than 110 countries, and Oman is one of our key market where we have installed more than 100 number of machines. In terms of certifications, we have our all products are CE certified, and some of our products are FDA certified as well. Like our X-ray machine and the C-arm, they are FDA certified. The strength of our company is not only our products but also our strong customer support, good relationship with the customers, and continuous improvement. Thank you very much. Thank you, everyone.
Thank you, Abhishek, particularly for saying that 100 of your machines are in Oman, and there are many
Yes, sir.
more to come here, and that your
Yeah,
products
thank you.
are very highly certified. C certified, you said. I presume that that's the high standards in medical devices. But
Yeah,
all
C
in all,
certified as well as
That's the
FDA
European
certified.
system, sir. That's
very
the
good,
European
excellent.
C certificate.
Next, Sonia.
Mr. Mayank Rohtagi from Healthium.
I'll request everyone who speaks 1 minute, please, so that we come to the essentials quickly and we continue with the session and conclude early. Mayank
Yeah, thank you so much, sir.
Rohtagi,
Am I audible?
1 minute.
Yeah, I'm there.
Go ahead.
Yeah. Yeah, thank you, Honorable Ambassador, for giving us this opportunity. I represent Healthy MedTech Limited as a global head for global government affairs and market access.
No, we can't understand. Hold on, Mayank, speak slowly. 1 minute, but slowly,
Yeah.
so that we understand you.
So,
Go ahead.
thank you. Sure. Is it better now?
We will have to make do with it. Not very optimal, but go ahead.
Okay. So I heads of global government affairs and market access for Healthy MedTech Limited, sir, which is the largest independent surgical consumable company based out of India. Primarily, we operate in 4 therapeutic areas. One is arthroscopy, which is sports medicine for knee and shoulders, where we have implants, instruments, shaver systems, and the 4K arthroscopy tower for minimal invasive surgery. Wound closure products, sir, especially sutures, endostapling portfolio, meshes for hernia surgeries. Then wound care products. So broadly, those are the 4 broad therapeutic areas, and wound care, which includes surgical dressing and infection prevention pre-op and post-op. We have about 7 manufacturing sites, 3 R&D centers in the country. All our plants are US FDA approved. We are the only Indian medtech company which has all US FDA approved plants. From a global regulatory perspective, sir, as all our products are US FDA approved, CE certified under UMDR, and MD SAP approved. Of course, the ISO certification is always there. We're exporting our products to about 90 plus countries, hold 100 plus patents, current global patents. So that's a broad footprint, sir. We are the 4th largest suture manufacturer in the world in terms of volume and largest in India. We're the 3rd largest arthroscopy player in India. And we are the world largest suture needle manufacturer in the world by volume, because of which 1 in 5 surgeries globally uses a Healthy MedTech product. So currently, from an Oman perspective, there's a challenge which we would like to bring to your notice. If that challenge gets addressed, there will be huge opportunity for Indian medtech companies to kind of leverage the whole this SEPA negotiation or agreement which is there. Currently, sir, what happens in Oman is, which is a primary tender business, tender-driven business. The companies, there are bucketing which happens. So primarily companies which are representative of developed markets such as US and EU are kind of qualified in bucket 1, and companies which are based out of India kind of fall in the second level of bucket list. So what happens is generally preference is given to companies for tender or procurement which fall under the bucket 1 category, which is primarily the companies from developed markets. So that does not provide a level playing field for us. The idea is, if Indian companies who hold certain global certifications like us can also be moved to the first bucket where the US and EU companies are presented, that will actually give us a fair chance and opportunity to kind of do business in the Oman region, and also to give us a level playing field. So that's one area, and that's how we can better leverage the opportunity which the whole agreement, SEPA agreement, has laid on for us, and of course expand our footprint as well. From a duty and regulatory perspective, there are no issues on that front, but sir, this is just one issue which can be addressed. and our products are much more cost effective, as Praveen had indicated in his slide. So that's one support which we would require your support, sir, in this, in getting this issue addressed. Thank you.
Thank you very much. Hopefully, you will be writing to the embassy also on this challenge which you have identified. I think my colleague here also mentions that that is true indeed, that some established brand names actually get first bucket treatment and the others get second bucket treatment. But she also tells me a solution that if you tie up with an existing Omani company, there is a possibility of getting kicked up, given
So,
that the Omani comfort will come there.
So, but the
Hold on.
problem is on that point. So, just on the second point, what happens is we have been trying to get the right partner for us. As I'll talk about the healthier. But unfortunately, the problem is the partnership doesn't foresee, because they also foresee that challenge that Indian, even if I give that partnership from a business headway, I'll not be able to leverage the platform or the opportunity which lies ahead for us, because we are an Indian made product. So getting the right partner has also been a challenge for us. So.
The other solution could be that you start having some kind of validation, in-country validation in Oman. So have you considered that? So on all these lines, please do send a piece of paper. We'll see what can be done. But one thing is to understand the lay of the land and try to insert yourself through a channel which is functional. So one of the functionalities can come in the nature of, if you're actually manufacturing here. We also heard the Ministry of Health representative speaking, saying that there is a price advantage that they give in any of the Ministry of Health tendered opportunity. So consider all those things, and I know that there is a trade-off between losing a market versus investing here and then getting a market kind of thing. But be as it may, write to us. We'll see what can happen. Thank you very much.
Sure, sir. Thank you.
Mr. Nimish, yeah, Mr. Nimish from TransAsia.
Nimish, TransAsia.
Hello. Hi. Hi,
Hi, Nimish.
Good afternoon. I hope I'm audible, visible.
Yes, you are.
Wonderful. Just share the screen with you. First of all, thank you for having me present. It's really an honor. I'm representing Arba Transasia Group. We are.
Nimish?
Yes.
Make it full screen. Make
Sorry.
it full screen.
Better?
And see if your echo can be controlled. Otherwise, go ahead. Time being short, go ahead. Take 1 minute. Present your presentation.
Okay.
Go ahead.
I'll be very quick. So representing Arba Transasia Group, we are one of the largest manufacturers of IVD equipment and reagents, headquartered in India. We serve over 100 countries. We've been in the market for over 40 years. We have multiple factories in India, across India, in Mumbai, Sikkim, Seeps, Baddi, and Daman. We also have factories in Czech Republic, R&Ds in France, in Austria, and in the UK. We have complied with all the certifications required for CE IVDR, which is the European equivalent of FDA. We have also complied with all the Indian regulations. Today, we are selling globally. We have a wide range of distribution networks across Africa, Middle East, which I manage personally. We have grown the region significantly over the last 6-7 years as well. We have 12 international subsidiaries and over 150,000 active instruments worldwide. Some of our machines I'd like to showcase right now would be our clinical chemistry range. We have semi-automated to the fully automated analyzers, as well as the reagents that are dedicated to the analyzers. All our analyzers are closed systems, and the reagents are built for the analyzers. We have manufacturing of the reagents in India, in Czech Republic, as well as in Russia and Indonesia. We'll be expanding soon. We also cover hematology, coagulation, and ESR. As an IVD manufacturer, we also have we offer a full solution, and we have an LIMS software, which we have also deployed across the Middle East, helping labs automate their workflows and also help them get accreditation like JCI and CAP accreditations. It also helps lab chains manage multiple sites, manage the devices, and control and monitor the quality of the results that they're publishing to the EMR. In Oman, we've been very active over the last 16 years. Across Oman, in standalone labs, referral labs, and hospitals, we have installations, over 400 installations over the last 16 years. It's been, steady growth. And you could say on average, around 25,000 to 40,000 tests are run on an Erba device per day in Oman, which is a very interesting stat for us. And we're very proud to say we work with Lifeline Medical Groups, which is a large hospital, Burjil, Hala, Wadi Kabir, and Helix Labs in Oman. These are some of our notable clients. We do serve all the ranges in Oman: hematology, clinical chemistry, critical care, urine, and coagulation. In IVD, how it works is the machines we produce and make, we're supposed to give it to the lab free of cost without any upfront payments from the lab, and we kind of get a cost per test model. So we are investing in the labs essentially and investing in Oman. We believe in the country, but we believe in the future of the healthcare sector in Oman. And what I'm facing a little bit of challenge with is, considering we're giving these machines FOC and placing them in the labs, we are still due to pay taxes on a lot of spare parts and a lot of consumables that are being used every day in over 400 labs. And as we scale the business and we scale the install base, the VAT and the customs duty is still applied on very necessary consumables needed for running everyday tests. And I'm looking forward that maybe the CEPA would be a great opportunity for us to mitigate this or reduce it, and will make us strengthen our footprint even more in Oman and help us invest even more. We also would like to collaborate with Oman's private sector and public sector with our LIS solution. We have a very comprehensive LIS solution that will allow data-driven insights across all the sites, across private labs as well as public laboratories, which will give information like demographic information, prevalence of any diseases, by gender, by age, by multiple filters. You're able to check what is the situation in any state of Oman. So we have this software, and I'm looking at deploying it in Oman. And I know we have a lot of stakeholders from the healthcare industry, so please feel free to reach out to me if you have any interest in deploying an LIS in your lab. Thank you for your time today. You can feel free to reach out to me, my number or email address.
Thank you very much. Thank you very much. And I think with the SEPA getting into force from 1st of June or sometimes near future, would provide some kind of competitive advantage to the Indian products wanting to make inroads into Oman. So best wishes to you, but thank you very much for your presentation.
Thank you, sir.
Yeah, Mr. Sandeep Gupta from J Mitra.
Sandeep Gupta, J Mitra. Sandeep.
Good afternoon.
Good afternoon.
Yeah. Good afternoon, sir. Good afternoon,
Namaskar.
everyone. Namaskar. My name is Sandeep Gupta, and I am representing here J Mitra and Company Private Limited. J Mitra is one of the India's leading manufacturer in the field of in vitro diagnostics, established in 1969. With more than 5 decades of experience, we build a strong reputation for the quality, reliability, and innovation in diagnostic healthcare. Our manufacturing facility follow stringent quality standards, and we are committed to deliver accurate and affordable diagnostic solutions. We have a strong and growing export presence, supplying our products in many countries across uh, Gulf, Gulf countries, Asia Pacific, uh, Northeast Asia, African continent, and Latin American countries. We are closely with our distribution partners to ensure consistent supply, technical support, and long-term business relationship. In our portfolio, we have a wide range of the rapid and ELISA products like HIV, hepatitis B, hepatitis C, dengue, malaria, syphilis, chikungunya, leptospira, and many more products. And also we have a wide range of the blood groupings as well. In addition, we are offering the home test products range like dengue home test and a celiac home test, which will be providing the convenient and early detection solution. At J Mitra, Our mission is to support early diagnosis, improve patient outcome, and building strong global partnership based on trust and quality. Currently, we are looking good partners in Oman who can become the distributor for our diagnostic products and distribute in the market. Thank you so much for this giving the opportunity for giving me the presentation for that.
Sandeep Gupta ji, thank you very much. Thank you.
Thank you
Miss
so much, sir.
Miss Deepti from Scanray.
Deepti Scanway.
Scanray.
Scanray.
Mr. Shailendra will take it
Yeah.
forward from
Hi.
Scanray.
Yeah.
Shailendra, go ahead.
Yeah. I'm Shailendra. I represent a company, a key Indian company called Scanray. We are a Indian global company, started in 2007 by a group of engineers. Today, we are a company of 800 people spread across the globe, and our products are represented in 100 plus countries, directly and indirectly. We are mainly into manufacturing of. I'll just share my presentation. Hope you can see this. Yeah, we are into manufacturing of diagnostic X-rays and critical care products. Our product portfolio includes almost 50 plus products, which are all homegrown. We have developed these products in India in last 20 years, and we have our operations in India. This is our facility in India. Then we have our operations in Italy, where we manufacture X-ray tubes and develop certain products. We were in limelight when during COVID, we supplied more than 42,000 ventilators to Government of India during the pandemic period. Our product portfolio includes mobile and fixed X-ray systems, surgical C-arms, then patient monitoring systems, ventilators and anesthesia delivery systems. All these products are CE approved and CE and FDA cleared products. Okay, and we are OEMs for many companies, and we can proudly say we are the only hardcore Indian manufacturer. That's all. Thank you.
Thank you very much, Shailendra. Very good presentation, I must say. Very brief, but yet very impactful. We could get very good glimpse of what all you make, the good facilities which you have, the product range, which is very, very enriching and wide. So thank you very much, Shailendra.
Thank you, Excellency.
Thank you.
Yeah, Mr. Ashish from Poly Medicure.
Ashish, Poly Medicure.
Yeah. Mr. Ajay George from BIPA Drug Laboratories Private Limited.
Yes,
Ajay
thank
from
you.
Deepa. Yeah. Ajay, go
No,
ahead.
yeah, thank you very much. It's BIFA actually, not BIPA. It's BIFA Ayurveda. We're based out of Kerala.
Okay, Ajay.
Can you hear me? Yeah, can you hear me?
Yes, we can hear you. Go ahead.
Yeah. I've not been able to prepare a presentation, but the last time, the year before last, I had represented the Oman delegation of the CI from Kerala. I had the ease of doing business panel of CI in Kerala as well. I represent the Ayush sector. We are primarily manufacturers of Ayurvedic formulations, especially modern formulations like tablets, capsules, and syrups. And also we have a large premium wellness product and beauty care product line as well. We have been trying to enter Oman in different ways. I mean, I would like to voice the concerns of Ayush industries from India as well, because I guess one of the key challenges what we find entering Oman is primarily the registration process of formulations, especially formulations like tablets, capsules. I think there is no clear-cut process. Only very few Indian companies are able to penetrate the market. I think maybe a handful are registered there right now, because the process of registration is very rigid, and it's very time consuming. So it takes a lot of time. Plus the registration costs of formulations are very, very high. So this invariably makes it difficult for any herbal company, to enter the Oman market. So this is something that we, in fact, in the delegation, we met with the regulatory authority also. So we mentioned this to them as well. But I don't think subsequently it was followed up well. But I think that is one issue that I think the Ayurveda industry from India would be facing to enter Oman. We have in fact been there with our personal care products with one of the distributors in Oman. The other area where we find there's good opportunities in the wellness space, because there are a few Ayurvedic centers already in Oman. You might be aware, Your Excellency, because I think there is an issue related to the approval of therapist. I think that is a very strange rule that we have in Oman, because they need to come only from 2 or 3 colleges in India. And there's a large shortage of therapists, because this approval process will not let a sender be able to appoint a therapist in Oman. So I've been there a couple of times, I think, but I think this has been what we've been hearing from the Omani counterparts also. The potential is very high, as there are a lot of demand in the market. So this is an impediment for investment. I mean, if you look at Oman, Oman can be a great place for developing wellness centers in the Middle East, because one very, very open environment for investment, besides a very scenic place, with beautiful beaches. So probably if you look at Kerala, we are attracting a lot of patients from across the world for wellness treatments, for Ayurvedic treatments. So the same model can even be emulated there in Oman, leading to larger investments and also even a larger business potential. Three issues. So primarily, which I would like to underline, one is the registration of formulations. We need to have a more compliable framework in place, number one. And the cost of registration of formulations is very exorbitant, which we've raised with them. But for them, it's reals. So when they convert it, they find it very cheap. But I think as far as Indian companies are concerned, because the market is small and the market is to be developed, so it is going to take time. No Indian company will invest so much of money. Only 3 or 4 or 5, maybe under 10 herbal companies are registered there in Oman. One major impediment. The second is about the approval of therapist, which is a major challenge, because all the therapists are moving to Dubai right now, where the process is much easier. And most of the Ayurvedic centers in Oman are finding it difficult to get therapist, because one, they need to be experienced. Two, they need to come out of 1 or 2 or maybe under 10 therapist training institutes in India, where they have hardly any therapists available to be placed to Oman. So these are elements which we find uh, not letting the Indian Ayurvedic industry establish in Oman. I'm saying both ways. One, to enter. Two, there's a huge potential to set up Ayurvedic centers in Oman, which is also getting blocked. So we need a clear-cut framework, reduction in cost, and a process which is more compliance-oriented. So I would say I'd probably be doing what I would want to say in a minute, I think, because time is limited. So Your Excellency would like to put this place. And if we are able to bring in a framework, I'm sure there's a lot of interested companies to invest in from Kerala into Oman, and also there'll be a lot of companies will be interested to enter the market as well. So there could be a mutual benefit that we see with the SEPA in place. I think we'd really need your support, and we'd be happy to really present it as a paper if you want to. And I think this is a very critical thing for the Ayush industry to grow in Oman. Thank you.
Thank you, Ajay. Incidentally, the issues which you mentioned are in the knowledge of the embassy, but it will be helpful for you to further articulate based on your own experience. Comparing it with the experience in UAE would be much more illustrative. And also the impact of this kind of bottleneck, whether in the product registration or for the therapist, into the overall traditional medicine oblique the wellness collaboration would also be helpful. Essentially, to point out what are the opportunities which the two sides are missing out for want of this ease of registration and the therapies. Please do send across those, and your paper, if it comes to us, will be extremely helpful. I understand therapists, the data process of Oman goes only by the empaneled kind of colleges or institutions from where the therapists come. They all happen to
Absolutely.
be from Kerala, and
Yeah.
Kerala internally has decided against these institutions for some reason, because of which we went to Ayush and asked from them the top therapist producing institutions. beyond Kerala, on top of India, which we shared with them in the data process. But companies from India being behind this exercise, missing out on the therapies, and the paper, if it comes suitably, we'll again take it up. It is a constant exercise that we had to undertake. But
Thank you.
point well taken. Thank you, Ajay.
Yeah.
Thank you very much.
Thank you, Your Excellency. Thank you very much. We'll send you a document, and we are also invariably trying to lobby the Kerala government. I've been heading the panel to lobby, but I think they don't somehow seem to understand the importance of what we're trying to speak to them. In fact, the additional skill acquisition program, which is a quasi-government organization, has also come out with a course, but which is not yet approved by the Oman government. So I think there are a few things. We'll put it down onto a document to you for your understanding, so that we can take it up further with the government as well. But I feel that there's a huge potential, and there is a potential which we are both the countries are missing out. So I would say this is a very important point for us to raise.
And a considered paper from the industry sent to Ayush, and Ayush vetting it and then sending would be carrying much more weight. So because government of Oman, as you know, goes by the who is the one representing kind of thing. So Ayush representation there will be helpful, and not to forget about this whole 3 or 4 companies which are able to successfully register their products is itself illustrative. Is it their larger financial muscle that allows them to do that, which others don't have? In that case, maybe
Absolutely.
there's a case for amalgamation or integration, at least to introduce some products into Oman. I don't know what is the model of entry, but the existing success stories will indicate the channel which we need to pursue as we try to introduce more products. So our own industry will have to reorganize itself. Market of Oman may be small. I don't know whether once you registered in Oman, it can have a seamless presence in GCC, may not be. So in the end, it's a small market in any case. So we have to come with those essential part. But since I understand that the wellness center for Ayurvedic clinic, etc., they need to function. That will require a minimum set of products. I don't think there are more than 6 or a dozen which are available in the market. Others coming in some other fashion from some other country, not necessarily legally available in Oman. So these are the challenges. Fully agree. But we have to put our mind as Team India to see what is the way forward on that. See whether you can, because you do have a very good understanding of Omani's side, and therefore maybe you can lead that process and send the paper via Ayush.
Yes.
Thank you very
much. Thank you so much, Your Excellency. We'll do that. Thank you.
Thank
you. Dr. Hardik Ajmera from CP Hospital.
Hardik Ajmera, CP. Hardik Ajmera, CP Hospital.
Mr. Prashant from Leelavati Hospital.
Prashant, Leelavati.
Mr. Naresh Rana, Chief Growth Officer, Cryo Tree Technologies Private Limited. Mr. Naresh Rana.
Naresh Rana, chalo bolo ji.
Yes.
Go ahead, Naresh.
Hello, sir. Hello, sir.
Hi.
Thank you. Thank you for giving me this opportunity. I'm sharing my screen.
1 minute, Naresh, if you can, will be helpful.
Sure. I'll do that, sir.
Thank you. Please. Full screen, please.
Yeah. Yes. Okay. So I'm representing Cryo Tree Technologies. We are a healthcare IT company. We do have our presence in 11 countries, India and outside India. Like Oman is one of the countries where we do have our implementation. In fact, one of our client, the Badal Sama group of hospitals, Mr. Latif was there. He has addressed the audience initially. We are a healthcare IT company. We do have our HIS, which is implemented in Badal Sama group of hospitals. At any point of time, more than 10,000 users, doctors are using our system, and our hospitals are JCIA and NABH accredited hospitals. We do support ICD-10 as well as ICD-11. I'll just try to move it quickly so that I'll not take much time. Sorry. We do have the different set of modules catering to all different departments of the hospital. Regarding all the transition department, be it right from the nursing, the doctors, registration, the lab, pharmacy, almost. So different 40 modules catering to all different departments. On top of that, we do have mobile applications for doctors, nurses, the patient, where a patient can have all those patient portal, where patient have all the features like taking appointment, viewing reports, bills, capturing their vitals, and all that stuff. The Power BI dashboards for the management, so that they have all the data on their mobile and on the like readily available, so that they can have their day-to-day meetings for that. We do support it. We do have actually worked a lot on interoperability part using ISO 7 and FHIR. These are our primary stakeholders: the clinicians, the clinical care providers, the patient, and the management. And we cater to all of these using the main HIS, core HIS, as well as the mobile applications. I talk about each of these. If I talk about the dashboards, we do have CXO dashboard, which I'll not go into details, but it gives you a glimpse that what all is happening in the hospital. All of this is a clickable drill down data. So if I click on any of this information, I'll be able to go to the nth level. So I can, for example, I can see the OPD count or its revenue, how many patients have taken appointment but didn't come up to like avail that appointment, doctor wise, department wise. I can go up to the patient level on any of the data can be drilled down to the nth level. Similarly, for financial dashboards, all the financial data for CFOs of the hospital is available on their mobile, and the real-time discharge dashboard, which is again used for this is one of the pain point for hospitals where they want to track it on real-time basis, and instead of doing an post-mortem that why the delay is happening in discharge, they can track it on the real-time basis and can take corrective measures then and there. Similarly, dashboards for supply chain management and the audit dashboard for the KPIs of the hospitals, the mobility solutions for, like I mentioned, for doctors, all that they can do on web application, they can do each and everything on their mobile apps. Similarly, for the patient, F&B department, audit and feedback. We are also doing a lot of work with respect to AI in healthcare. Some of these are mentioned here. On generative AI part, the care voice assistant is based on doctor and patient conversation. The whole prescription can be generated. And it's not only the capturing of data, it's not just speech to text. Instead, it is actually capturing data in those relevant data points. Similarly, no-show predictor AI, smart surgery estimator AI, giving a prompt to the doctor where they can actually give a prompt, or they can actually ask a question on the patient context. And for example, they just say that, okay, can you give me the critical lab results for this patient? And system will analyze, find out the critical lab results of the particular patient and present it then and there. So all of these, like some of the AI components which we are using in our application and are actively used in various hospitals in India. In addition to that, we are also doing the AI-powered radiology interpretation for ultrasounds. This is what we are doing for UP in our collaboration. There is another project which we are doing for UP is Matra Shakti AI, again, which is using AI. It's a spoke and hub model where the smaller centers will be connected to the district centers, and an active care will be provided to those where the doctors are not available, or doctors are full-time doctors cannot be reaching out to those places. Those will be taken care. Similarly, another project which is going on is AI-powered trauma centers, which we are setting up on again in collaboration for highways and expressways to reduce the fatalities. So these are all AI-related initiatives which we have taken at different places. In addition to that, okay, I'll just skip this. These are some of the features which I was talking about. The kiosk implementation, the queue management, and all the smart reports. Okay, I'll just. Okay. These are some of the international places where we have implemented our software. Like I mentioned, Badal Sama Group of Hospitals is one of our clients. Similarly, Burjil Holdings, again in Oman. So we do have a presence in Oman. In addition to that, we are obviously looking for more opportunities in Oman where we can serve those hospitals. Last year, we have implemented our software in all the government hospitals of Mauritius, the 158 hospitals and medical centers in Mauritius, and the sponsorship was done by United Nations. So this is like I try to keep it brief. We are very actively looking for more opportunities in Oman and GCC, and we do serve our clients in a good way.
Thank you, Naresh. Thank you very much.
I hope I'm not taking much
Absolutely
time,
wonderful.
sir.
No, but you did take time, but for a good reason, I must say so. Because
Thank
the
you.
power of AI and then the technology that you demonstrated for integrating the entire healthcare sector to have the maximum bang for the minimum buck in the entire healthcare sector is an outstanding example. Thank you very much. And more importantly, you already are present in Oman. The idea
Yes,
is
sir.
for you to scale up your presence here. Hopefully, you succeed and
Thank
bring in some kind of productivity gains to the healthcare system here. Thank you very much.
Thank you very much.
Next, Mr. Vipul Gupta Sipla.
Vipul Gupta Sipla.
Preeti
Hello, sir.
Verma.
Vipul.
In the absence of Vipul Gupta, I am Vishal and I'll be taking the stand here. If I may just go ahead with the presentation.
Vipul Ramesh Sipla.
No, so
So your
technically I'm
voice is
Vishal. In
fading
the
away.
absence
Speak
of,
into the microphone and show your video if you can.
yeah, sure. I'll go.
And your presentation, bring it up quickly because we have 1 minute rationing of time as we are coming to a close and we are pretty delayed. Yeah, presentation is
Sure.
visible. No, you are visible.
I'll just
Presentation
share
is
my
not.
presentation as we speak, yes.
If you have one, so bring it up. Yes, go ahead. 1 minute, please. Go ahead.
Just a second, sir. Okay. I'll just speak about the country. I think so there's some issue with the presentation here. I'll just give you a brief about the company and per se. The very first thing is good afternoon, sir, and all the delegates on the call here. So I'll be representing Cipla, that is about a 90-year young company with about a market share of about 3.2 billion in revenue and standing tall in the top 3 companies in India. And as we speak, we also have been successfully able to cater to business units in Oman as well for the last 25 years. To give a brief about the company, we have been having a global presence and we are operating in about 74 countries as of date today with the manufacturing units of upwards of 46 units and our business is mostly concentrated towards the domestic US and the Middle East per se, and we are able to garner all this business with the help of the therapies that are we are operating in right now. So Cipla is a pioneer in respiratory segment, and we are also venturing into other segments as the needs of the patient in country. So in Oman specifically, we are into the respiratory, the ARV, the antimicrobial, and the PPI segments. But in the coming future, with the help of the SEPA agreement and the reduction in the basic registration timeline, that would also help the company and also the patients to get access to medicines which are from the portfolio of obesity, anti-diabetic, and metabolics. So there are 3 things that I would like to highlight here basis the SEPA agreement here. The very first thing is that due to the shortened timelines in the registration process here, we'll be successfully able to continue our business for the longer term. And the very first thing is that there are 2 aspects that Cipla concentrates on, that is the business growth and continuity. So growth wise, fortunately, we are present in all the 11 governorates across Oman, and we are able to just garner more business from the increasing the business yield in all the 11 governorates here across the 25 years experience that we have. So moving on to business continuity, we are also venturing into the new therapy areas which are of interest in Oman, and for that reason also we have manas that I've put forth to all the delegates and the companies that are on the platform right now. If you want to partner with Cipla with a product that has been already registered in the country, we do have an excellent established field force here, and we will be able to help you to have a greater yield for the business and also commercially excel with a strategic partnership that we look forward to have with you in the near future. So thank you for your time here. That was a brief about my company and our presence in Oman.
Thank you very much. Really appreciate. Cipla is one of the biggest companies of India, and good to have your presentation and confirmation that you're present in Oman. Thank you very much.
Thank you.
Miss Preeti, Miss Preeti Verma from Biored Medicis.
Biored. Preeti. Preeti, vibrate.
Mr. Sandeep from Kim's Hospital, India.
Sandeep, Kim's Hospital.
Mr. Mujib from SSO Cancer Hospital.
Mujib, SSO Cancer Hospital.
Hi, good evening.
Yep, good evening, Mujib. Go ahead.
Just presenting my screen.
Yep. What is SSO?
Specialty Surgical Oncology.
Okay. Full screen, please.
Yes, sir.
Good. Good to go
Right.
ahead. Continue.
Thank you so much. Good evening, everyone. And thank you to the Embassy of India for organizing this important India-Oman Network initiative. I am Muni Banwar representing SSO Cancer Hospital. I'll just keep it very short considering like we are running short of time. So,
थोड़ा right कर दो. Correct.
Yeah.
बंद कर, sorry. Mute तो करो. No, Mujib, go ahead.
Yeah, sorry. Okay. So the SSO network. SSO currently operates with a 25 plus full-time surgical oncologists, 60 plus visiting surgeons. We have 6 hospitals in India and we do 5,000 plus cancer surgeries annually. Okay. Our teams are like organized by organ systems, including GI, breast, thoracic, etc. This organ specific model allows deep surgical expertise, protocol driven care, and consistent outcomes across the network. So the clinical model and procedural expertise. So at SSO, every complex case is discussed through multidisciplinary tumor boards and managed through standardized clinical protocols. Our teams perform advanced oncology procedures like CRS IPEC, GI resections, advanced head and neck surgeries, and much more. So speaking about our scale, growth, and international reach, so SSO has built a scalable oncology network with patients coming from like more than 10 countries already. We are catering patients from Africa, the GCC, Middle East, Southeast Asia, and also like select international collaborations from the US market as well. On the opportunities for collaboration, we see strong opportunities for collaboration between India and Oman in be it in terms of like clinical research or outcome-based studies, academic exchange, surgical training, and multi-center oncology programs. So on the closing conclusion, we are building specialized-led protocol-driven oncology network focused on advanced cancer care, research, and international collaboration. Thank you again for giving this opportunity to present India in this forum.
Thank you very much, Mujib.
Mr. Majid Habib Khan from Yashoda Hospital.
And meanwhile, let me also say that all those text messages being added to the portal, we will be also having a copy of that, Omari, correct, as part of the AI transcription. So all these messages which are being added will be available for everyone to go through. Once we upload in a day or two, we do that. So if you check day after tomorrow, you'll get everything on the same portal there. The same notice board through which you got to know about this event. Very detailed entries have been made. Thank you very much. Now, please call again the name.
Mr. Venugopal, Telangana Life Sciences. Who's there? Ms. Sharmila Devodas from Meditech Health System.
Sharmila, Meditech.
Ms. Jasila T. Bukhari, Head of Punarnava Hospital.
Hi, I'm here, Sharmila from Mediotech.
Yes, ma'am. Yes.
Yeah,
I'm
go ahead, Sharmila.
representing CI Tamil Nadu. I'm the I'm in the state council, and I'll be presenting the Tamil Nadu angle on behalf of CI Tamil Nadu. I hope you can see my screen.
Yes, can you please make it full screen for the benefit of
Yes.
everyone? Yeah, good.
Yes.
Go ahead. Floor
Okay.
is yours.
Yeah, so
Continue.
the strategic context is, of course, India-Oman SIPA and Tamil Nadu's expertise, healthcare expertise with respect to medtech, as well as the delivery and the Vision 2040 alignment, as well as the 4 priority areas, which I'll be talking about, and the partnership pathways. know, healthcare is one of the most actionable sector under this new bilateral framework, and it extends beyond trade to service delivery, digital transformation, which I'll be focusing a lot on today, and medtech manufacturing, talent development, and joint innovation. And to link hospital systems, connected care, manufacturing, and workforce development, and build a regional model with relevance for the Gulf and African markets, and particularly in both public health as well as in private health. As we know, 87% of the healthcare in Oman is public health, and we'd be happy to provide the right subset of models from our experience in Tamil Nadu. So CII Tamil Nadu has got a very close working relationship with the government, with the Department of Public Health and the National Health Mission Tamil Nadu. So we'll be able to facilitate the PPP models and to strengthen the healthcare infrastructure and the digital transformation with respect to health tech and service modernization, and also a heavy policy focus on the innovation, the healthcare quality due to the digital transformation, and the economic diversification in terms of skilling, etc., and provide a gateway for wider GCC and adjacent go-to-markets as well. So it will not be just a market access story, it will be a partnership platform. That would be the synergy. And why Tamil Nadu? As we all know, Tamil Nadu is one of the strongest players in India, and it's about a $20 billion market, and it does get about 40% of the patients from Gulf Africa and Asia. And the state combines a very broad public health base with advanced tertiary and quaternary care, with over 2,000 hospitals and 11,000 plus government health facilities, and medical college, private and public medical colleges spanning the state. And Tamil Nadu has been positioned as a medtech and digital health hub, with the as we all know, it is one of the leading manufacturing states, with about 20% of the GSDP going to manufacturing, and with medical device manufacturers, digital health firms, and over 300 plus healthcare startups already active in the ecosystem. So we do have 28 incubators, and we do have and we have IITM Research Park, which has over 500 startups being incubated, and which provide a very robust ecosystem. And the industrial corridor is also something which is supporting the electronics, precision manufacturing, and export-oriented supply chains. And hence, it's a natural base for patient monitoring, wearables, diagnostics, biomedical electronics, and AI-enabled health platforms. And it aligns very closely with Oman's modernization and diversification agenda. So the first strategic area that I'll be focusing on is digital health and connected care. So today we are moving from medtech to tech med. So tech med is nothing but, like, having, instead of episodic hospital-based treatment, continuum of care beyond hospitals, and using Internet of Medical Things, and be able to have that continuum of care across care settings. So, and it is supposed to be a $900 billion market this decade. Tamil Nadu's ecosystem expertise spanning telemedicine, EHRs, platforms, and digital skilling are all going to play a major role. And the shared disease burdens with GCC and Oman in particular, the very high incidence of NCDs and age-related needs, create a very strong basis for joint digital models, which will lead to the public health systems strengthening with technology. So the collaboration scope would be hospital-to-home pathways, remote patient monitoring, telehealth integration, and workforce enablement. And with medical value tourism, this whole continuum of care comes into play even bigger in a more massive role. So that is also something. And we have case studies like, with the companies like Mediotech Health Systems, which provide this full stack platform across care settings, and spanning preventive and curative care. It's an AI augmented healthcare and medtech platform built around India's first clinical grade wearable, and featuring India's first cuffless BP and among the world's first few. We have patents for the same as well. So we have solutions for both preventive care and curative care. We work very closely with the government of Tamil Nadu, the Department of Public Health and the National Health Mission, and also with the Bangalore Municipal Corporation in providing community-based screening, doorstep screening for non-communicable diseases, and be able to provide AI-driven, lifestyle disease management programs for the government. Particularly the Tamil Nadu's Makkale Thedi Maruthuvam doorstep screening program has been digitized by us, and it has been successful. We've got over 1 million readings. And this is the Madurai model, as we call it, which is encompassing a technology platform, skilling, and improving the employment opportunities in terms of digital health support specialists and awareness campaigns, and the right set of referrals and treatments being enabled, and having real-time surveillance and risk stratification, enabling very good outcomes in being able to have controlled rates for good control rates for hypertension and diabetes. So, and major application use cases for population screening, OPD screening, occupational health, very, very useful for occupational health compliance. And so the second area is medical devices and manufacturing, where the partnership pathways could be joint ventures with the government of Oman. Technology transfer, we have a lot of IP here, which could be transferred with the help of, the startup Tamil Nadu and Guidance Tamil Nadu, etc. And we have regional distribution partnerships could be made available. We have more than 300 odd companies here in medtech space, in the medical devices space, and clinical validation partnerships also is possible. So the shared objective could be to create a regional healthcare technology and medtech corridor serving both GCC and Africa. And the third could be the workforce innovation and research, where considering Tamil Nadu's leadership in producing the health professional and specialists at scale, Oman's infrastructure focus and strategic planning complement our software, AI, and healthcare talent base. So the training priorities could be nursing excellence, critical care, biomedical engineering, hospital administration, and digital health specialists, right? And innovation priorities such as joint innovation centers, medtech incubation, TechMed incubation, AI validation programs, and data science initiatives to target the 10 million shortage according to WHO. And the strategic area 4 could be the medical value travel and cross-border care. Already thousands of GCC patients are traveling to Tamil Nadu every year, and we have high demand specialties which are quite critical, and the continuum of care is extremely important. And so this can be made using the digital health solutions, the pre-travel teleconsultation, referral routing, post-operative follow-up, and remote patient monitoring, cross-border records, alerts, and coordination. So essentially now we can move from a model of episodic to continuum of care across the border, and shift the model from one-time patient travel to continuous cross-border healthcare delivery. So I believe these are the places we can start now. The practical near-term collaborations could be in clinical and service models, including public health strengthenings, referral partnerships for Omani patients, remote monitoring and home care pilots, hospital digital transformation programs, medtech and market development, where you could target co-development of devices, validation and regulatory pathways, and distribution partnerships for GCC reach, and talent and innovation, particularly for digital upskilling, university and industry collaborations. We have a strong CI has a strong relationship with Tamil Nadu Apex Skill Development Center for Healthcare, who have multiple collaborations going on across the world for compliance as far as training is concerned, skilling is concerned for healthcare professionals. That could be tapped. And of course, the incubation and the healthcare ecosystem can also be tapped. So that is the the final slide is Oman's strategic vision plus Tamil Nadu's healthcare scale, digital capability, and medtech that could provide a very valuable partnership with regional and global relevance. Thank you.
Thank you, Sharmila. Very comprehensive presentation, I must say. coming from CII Tamil Nadu. Really appreciate. Thank you very
Thank
much.
you.
I think everybody needs to go through this detailed presentation to get nuggets of wisdom plus ideas which you have shared. And certainly we wish to do that. And to help everyone, we do have what I said, RAG, that retrieval augmented generation. Once we receive the PowerPoints and the notes sent by everyone, we'll be uploading and we will also be crawling through them for culling out relevant information of interest to everyone based on the keyword search. So all
Thank you
this I
so
invite
much.
you. No, thank you very much to you. Thank you.
And
And
just one
have
more thing, we'll be having a 6th edition of our flagship event for Tamil Nadu healthcare panel. I mean, a panel of CII. That will be in October. We'd be very happy to invite you and your team, Your Excellency.
Yes, we are on our portal. We'll be also having all sorts of these trade events, whether in Oman or in India, across various subjects. So that one through again RAG will be able to pull out an event of their interest, like what you're mentioning, October event there. Sometimes ago we heard something in Goa or somewhere September and back here. So we will be having a very good calendar of all the trade events happening in both the places, in the hope that people beyond virtual go to physical and connect face to face. So thank you, Sharmila, once again. Thank you very much.
Thank you.
Mr. Venu. Yeah, thank you, ma'am. Mr. Venu Gopal from Telangana Life Sciences.
Venugopal, Telangana Life Sciences, 1 minute. Are you there?
Yes, sir.
Yeah, I'm here. Good evening.
Go ahead.
Thank you for giving this opportunity, sir. I'm going
Namaskar.
to few slides I'm going to share. Screen. Okay. Can you able to see my screen?
Yes, make it full screen, please.
Yeah,
Maybe
thank you.
to... Thank
Thank
you.
you.
Go ahead.
Thank you for giving me opportunity. Basically, I represent the government of Telangana. I am from Telangana Life Sciences Foundation. My name is Venugopal Sankineni. I'm a vice president. Telangana Life Sciences is a Section 8 company belonging to government of Telangana. Our role is promote innovation and companies and ecosystem development. Today, I'm going to present Telangana ecosystem in Hyderabad. So, Hyderabad is the life science capital of Asia. It is home for talent, research, and manufacturing and innovation. We have 2,000 plus life sciences companies. Our ecosystem value is 100 billion, and we have 269 plus US FDA approved sites, more than New Jersey in USA. And we cater 1/3 of global vaccine production from Hyderabad. And we have 20 plus life sciences and medtech incubators. And we also have national research institutions like ICMR, Indian Institute of Chemical Technology, and CDFD, DNA printing. And out of top 10 global pharma companies, we have 8 GCCs in Hyderabad. And we also have a lot of national research academic institutions like IIT Hyderabad, NIPER, and also we do 40% of national pharma production in generics. And we have top 6 out of top 10, 6 global R&D company facilities. And we have 3 industrial clusters in Hyderabad. One is Genome Valley, most of you may be knowing, and that is exclusively for pharma manufacturing. And we also have a medical device park. And so we have Telangana is ranked among top in terms of ease of doing business. We have a centralized system called TG-IPAS. It's a single window clearance. Approvals and self-certification will be done in 30 days. We have a progressive policies, a lot of incentives, and we recently launched next generation life sciences policy in Davos. And we also have a good innovation ecosystem. We have a few center of excellences, antimicrobial center of excellence. We have a incubation. We also have a one bio. It's a biomanufacturing center of excellence in Genome Valley. We have a lot of talent pool, a lot of IT skilled workforce in Hyderabad, and we have a world class amenities as well. So through TG IPAS, over 28,000 companies approved since 2014, total investment up to $35 billion, and almost 2 million jobs created through this system. So as I mentioned, we have industrial clusters, industrial parks, Genome Valley. This development is happening from past 2 decades. We have great vaccine companies, world well-known companies like Biological E, Sai Life Sciences, and we also have multinational companies. And we have a medical device park, and also another cluster, GCC hub. Everything is like 1 hour from airport, and we are also coming up with new green pharma city. So coming to medical devices, as I said, we have an industrial exclusively for medical device park, spread across 3,002 acres, started in 2017. We allocated to 60 companies. Currently, 40 companies are operating. It is a very strategic location. Everything from here, financial district and the airport is 30 to 40 minutes. We have an advanced ecosystem supported by 1,000 precision engineering subject matter experts, and we also have a plastic manufacturers, who can capable of handling complex materials. We also have a testing infrastructure. We have a lot of testing labs, private and public, and also we have a rapid prototyping from government called T-Works, and we have a world's largest incubation center called T-Hub. We have a few plug-and-play infrastructures designed especially for medical device sector. So some of the medical device companies from our park is SMD. As you all know, it's the world Asia's largest and manufacturing company. It's located in our medical device park. We have a few companies called Huel Life Sciences that developed a COVID-19 test kit, and India's largest IV fluid company, Promia, makes 5 million bottles per day. And we also have Akriti, they deliver 10 lakhs eyeglasses in a record time. And these are some of the current product range: stents, orthopedic implants, wound care products, diagnostic kits, 3D print medical components, ophthalmic devices. Also, these are the line of activities: cardiac stents, again, dental equipment, wound care devices. This is the ratio predominantly. We have catheters and stent manufacturing, 3 companies existing in our park. So, as I said, it is centrally located. Few of the institutions nearby, and also the road, power, uninterrupted power. We have a dedicated water resources from state to the industrial parks, affluent warehouse facilities also available. So this is our layout, and here are a few pictures from our medical device park. We also have upskilling with different institutions and hospitals, AIG, NIPER Hyderabad, Indian School of Business, and there is a program with Terumo, Japan company. So we do create a lot of upskilling programs frequently. And here are some of the global companies. Medtronic and Olympus is here in Hyderabad. 8 of the world's top 10 pharma giants have chosen this city. So we have Lilly, Johnson & Johnson. Recently, last year, Lilly invested $1 billion in Hyderabad. We have Amgen, BMS, Merck, Sanofi, Thermo Fisher, you name it, everything is here. Apart from that, also we have global giants like Microsoft, second biggest office in Hyderabad. We have Meta, we have Google, we have Apple, everybody's here. So here are a few success stories. Medtronic, they have 100 plus engineers doing innovation work here. They have so far invested 500 million. And they also have a global capability center and innovation center in Hyderabad. And here is the few words from the CEO. And SMT also, like they make 2 million balloon catheters, 1 million stent per year. They have a 2 lakh square foot and 15 clean rooms. And they also export over 89 countries. And here are our contact details. I've been in this call for a long time. I hear a lot of companies from Oman. They are looking for a joint venture, collaboration, R&D facilities. So, you can reach out to me. I can facilitate. I can bring companies and bring them work together. Not only that, Hyderabad is also a medical tourism hub. We have a lot of hospitals like Apollo, AAG. They are well-known hospitals. A lot of patients come from Middle East. Also, we can also have a platform to do clinical trials if some Oman company is interested to do clinical trials here in Hyderabad with hospitals like Apollo, AAG. I can definitely facilitate. And also we have animal studies. So you can conduct animal studies. So we have big facilities here in Hyderabad. So any joint collaboration, joint ventures, or any opportunities for Hyderabad companies to expand their businesses, vice versa. Or if you want to have any idea, you want to do some prototype, you want to do some clinical trials on these medical devices, everything is possible here. We have a great talent here in this ecosystem. I'm happy to facilitate. Here are my contact details. And again, thank you for giving me this opportunity to present to Telangana government.
Thank you, Venugopal. Really very comprehensive presentation, as I could see, giving the real breadth and width of the entire existence of the life sciences kind of institutions there in Telangana. So beyond IT now, it's also bio and then the medical devices and other sectors which Telangana is now becoming famous for. So all in all, thank you very much, and you have given very many good thoughts for further collaboration, conversation. And please do send your PowerPoint if you have not done that, as I will be requesting everyone else also, because everybody needs to go further through a comb through all these presentations to understand and interact with each other. Thank you, Venugopalji. Thank you.
Thank you, Jay. Thank you. I will surely do that.
Yeah, Miss Jasila Bukhari from Punarnava Hospital.
Jasila, we had called her earlier.
Mr. Benjamin, Export Head of Concern Pharma.
Concern Pharma, Benjamin.
Mr. Rajul Jain, ELT Corporate Private Limited.
ELT Corporate, Rajul.
Yes,
Go ahead.
I'm there. Yeah, good evening, sir. I'm quickly going to share my PPT.
Okay. आएगा PPT होगा. Rajul Jain.
Is it my screen is visible?
Yes, full screen, please. Correct. Go ahead.
Yeah. So my name is Rajul Jain. I'm a founder of this company called ELT Corporate. So we are providing a regulatory and market access services to the foreign companies for particularly in India and Middle East. Our company helps the global medical device companies for expanding their operations for the Indian and the GCC markets. I personally have 18 years plus experience. We have 500 more clients, and we have a bigger clients from the Japan like Canon, and we have a clients like Medtronic also. So to whom we are helping in bits and pieces to the some or more projects there. So we are a team of regulatory professionals, legal counsels, business consultants, a team of the IITians and IIM chartered accountants does constitute our company. So I'm a founder of this company. This is my personal introduction. I'm academically chartered accountant, and a practicing lawyer, particularly for healthcare industry. And I've been a legal consultant, a business consultant for the Federal Ministry for Economic Affairs of Germany, also for bringing the German companies into India, specifically in healthcare space. So we end-to-end help them from bringing the FDI and other logistical help in India. So the same way we do the same help for the other countries as well. So our services precisely would be including Indian regulatory entries, and suppose if Indian companies wants to go to the Oman, so we would be helping them. So we have a office in the Middle East at this moment, precisely in UAE, and we help them in terms of market access. We help them to discover the distribution network. We help in technology transfers. We have tie up with all the major IIT incubation centers of biolife sciences in India. So wherein we make the inventory of the different inventions across the healthcare, and we take these inventions to the industry, and we help them for the technology transfers and also attracting the investments with the startups. So, for a Middle East, we are actively participating and investing in exhibitions, etc. So this is the latest of our. In February 2026, we participated in World Health Expo, and we have published several publications. Particularly, we have an market access guides for global medical device in context of India and UAE. So, why our company is one of the best company for offering these services? We have all kind of an experts under the one roof. So we have an practical licensing knowledge that's under the healthcare sector. Regulatory is the biggest challenge because it takes a lot of time. So market access orientation, since we have been led by the IIM grads, etc. So we have a management mindset wherein we are able to commercialize the products very easily. So apart from that, these are few of our clients like BPL, Lenskart, Canon. So Kai is a Japanese brand, Dover is a US brand. So and we have several publications. And apart from that, we have been regularly featured on major TV channels of India and across the globe. And this is my contact details. So I'm done with my presentation. Thank you so much for giving me this opportunity.
एक जून
सर 13 तारीख का डीवीसी है ना सर
हो गया चल खत्म हो गया
Yeah.
Thank you very much. Thank you, Raju. Thank you very much for offering your services to anybody wanting to look at India from Oman or other way around. Indians looking to Oman for further expanding their presence and business connection. Thank you very much.
Thank you.
A official from Sanjeevani Pharma.
Sanjeevani Pharma.
Mr. Mugesh Punt from AIG Hospital, Hyderabad.
AIG Hospitals.
Yes, sir. I'm here.
Go ahead, Mangesh.
A very good evening to all. In
evening.
public interest, I will skip my presentation here. I am also traveling. Thank you so much for the opportunity. Congratulations on SEPA, and double congratulations on organizing these ION online meetings. So India-Oman Network. It's really great platform. And just a brief with AIG hospitals. From past 30 years we are there. 30 years ago, we have started with the polyclinic setup, then a 200-bedded super specialty, 200-bedded gastro specialty hospital. And from past 7 years, we have 1,000-bedded hospital at Gachibowli, Hyderabad. And of course, not only Gachibowli, we have 3 units in Hyderabad now. So 1,300 plus beds with 600 plus consultants across 47 specialties. So this is AIG for you, JCI accredited hospital, catering patients from more than 45 countries all across the world. As I said, we have JCI accreditation, that is Joint Commission International. So we are providing gold standard treatment for all the patients coming across the globe. So again, at AIG hospital, we believe every passing minute is chance to treat someone. Our honorable chairman, Dr. D. Nageshwar Reddy sir, who is the only doctor in the country to have 3 Padmas, Padma Shri, Padma Bhushan, and Padma Vibhushan awards. He has a vision that a patient, common patient, global patient should get a world class treatment in affordable rates. So we are committed to that. Delivering our healthcare in across 47 plus specialties. We have Center of Excellence for Gastroenterology and Liver Transplant, also with hepatobiliary surgeries also. We do have excellent department of cardiology, one of the best in the country, oncology, likewise all the specialties. We have right now we have 4 cath labs with us. We have 25 modular OTs, 27 endoscopy suites, 400 seated auditorium. We have skill labs, we have animal labs. We're getting doctors from 35 countries who come to AIG for trained in to be trained in skill labs. We have DNB in all specialties. We have trained more than 7,000 doctors in past few decades. So catering, speaking about international relations, I'm AGM for corporate and international relations also. So in Gulf, we have strong presence. Even we, get patients from Oman, be it Ministry of Health or other departments. We have a lot of MOUs we have signed in Gulf. And we are committed to serve your patients with the gold standard treatment. We have translators in all languages. We do provide services for transportation and facilities to our patients. We cater them like a family member, so that our patient is our own brand ambassador. We don't have any aggressive marketing campaigns and all. So again, we are committed for patient services. So they are most welcome. And thank you very much for giving the opportunity to present here in this beautiful forum. Thank you, and won't take much of your time, as I know we are running behind the schedule. Thank you so much.
I really appreciate. Thank you very much.
Shelby Hospital.
Shelby Hospital.
My name is Tejas Shah. I am representing Shelby Hospital. Am I audible?
Shelby. Yes. Make it visible also, please.
Yeah, sure. So our president, Mr. Sanay, has some emergency meeting, so he could not attend. So my name is Tejas Shah. I look after international department as the head of department. I have visited Oman few years back and visited some agencies over there who refer the patients to India and Turkey, Armed Force, Royal King, and so on. We have a good presence in Africa, Middle East, USA, and UK. We are world level known for orthopedic. Dr. Vikram Shah and his team, he has done more than 175,000 joint replacement, which is one of the biggest joint replacement center in the world for knee and hip. We do revision cases. The cases which has been failed, like somebody has visited in Bombay, somebody has visited in Bangkok for knee replacement, could not make it success. They've been to Shelby and we made the patient walk. Then we have operated 6 times. He failed in Ghana. That lady African has been operated at Shelby Hospital. Internationally, we have tied up with the Bupa, Vamreda, Allianz, Aetna, UK-based foreign international insurance companies. Also, we have tied up some local-based insurance company in Africa. We arrange for airport pickup, airport drop. We have a different category of room, private room, suite room, twin sharing room, depending on the patient need and budget. We treat every month 40 to 50 patients from different countries in Ahmedabad city. We have also acquired in Delhi. We have a called Shelby Sanar Hospital in Gurgaon. All put together, we have 16 hospitals in India, and all put together, we have 2,000 plus beds. We are known for orthopedic and oncology. Having said that, we are doing wonderful job for kidney transplant, liver transplant, BMT, neurology, cardiac, and so on. We have a Nairobi, we have a clinic where we have doctors visiting there and we do a medical consulting camp. In Tanzania, we have tied up in the hospital where our doctors do and we do a medical camp. In Oman, we are looking for possible collaboration with some hospital or some clinic where we can do OPD. Eventually, we can plan for some procedure and surgery doing over there. So in case anybody is interested where we can collaborate in Oman, some hospitals and clinic, we can send our doctors, we do OPD collaboration. Eventually we can do some surgeries there, and those cases which are complicated in nature can be brought to Shelby Hospital, India for a medical treatment. So these are the options what we are looking at for possible partnership, and I will run just 4 to 5 slides quickly our presentation.
Yeah. Okay. Thank you very much. Really, Shelby, appreciate all those details that you provide of the outstanding services that Shelby is providing in the healthcare sector to the patients and providing all sorts of pickup, drop, and overall holistic experience of good healthcare in India. Thank you very much. I understand you've been to Oman in the past, so you are aware of the market here. Is
Yes,
there?
sir.
Yeah, yeah, yeah. So Shelby has been here, so therefore you are
Just one
picking up
request,
on.
sir. If just one request, sir.
Go
Just
ahead.
one request, sir. If possible, we would like to collaborate with some hospital or clinic where we can send our super specialist doctors there and we do a medical camp and eventually we can plan for surgeries if some possible types over there.
You may be already aware, but if not, let me tell you that entire Oman is famous for what they call as CME, Continuous Medical
Okay.
Education. If you are not aware, that's a platform wherein
Yes.
you send your super specialist.
Okay.
His specialist is so good that that
Okay.
kind of talent is not available in Oman.
Okay.
So he then asks the entire town,
Yeah, we can do
interacts with
that.
the relevant people in that hospital perhaps, and shares whatever comes to the mind of your expert. And that is one good way of connecting. I have seen incidentally at 11 o'clock in the night, doctors sitting in attendance to listen to something superlative in an area. And that is what I guess is what your entire idea is, to attract them and to appeal to their things to collaborate with you. Obviously, there's already a medical sector in Oman, mostly created by the Indians. The idea is to tell them the further value addition through our super specialty hospitals in India. So whatever strength you have, please do approach them with that, and hopefully they will be able to tie up. In case you need further details of that, we'll be able to share the details of the hospitals and wherever you want to send your super specialty expert to persuade them for CME. So all in all, please do try.
Yeah, sure.
That's a standard
Sure,
thing which
sure.
keeps on
Thank you.
happening here. So thank you once
Yeah,
again,
yeah,
Shelby.
sure. Thank you for it. Thank you, His
Thank you.
Excellency.
Yeah, Miss Pooja Dubey from MaxCare Healthcare.
Pooja, Max Care.
Mr. Jagannath Mishra, Vice President, Maya Biotech.
Maya Biotech, Jagannath. Okay.
A representative from Global Source Trading from Oman.
Global Source Trading from Oman.
I'm here. Can you hear me?
Yes.
Yeah, hi. Thank you for giving this opportunity. We have been in the market for more than 20 years. Our company is called Global Source Trading, and our parent group is called Global Conglomerate Company. Thank you for the opportunity, His Excellency. So we deal with everything right from surgical disposables and up to open heart surgery, super specialty items as well, and laboratory and IVD and all kinds of medical equipments and all sort of things. So we would be looking for more opportunity. We are already collaborating with some of the companies which was mentioned in the forum. We always look forward for more partnerships, and we can be reached out in social media, LinkedIn, Google, and all sort of accesses available. Thank you for this opportunity.
No, really, Manu, thank you very much, because companies like you are actually the ones who will convert some kind of opportunity into the reality. And therefore, I really
Thank you,
appreciate
His
you coming and talking about a company. Do send some presentation or some kind of lucid notes that you may have about GST. That will be helpful
Sure,
because
sure.
you indicate the channel of entry into Oman, to be very frank. That's the way I see
Right.
you. If anybody want to
Sure.
enter Oman, they can't simply come and start selling. They need to go to companies like you. So that will be helpful.
Sure.
Now, with that,
Thank you.
we come to the end of the scheduled presentations. But I do recognize there have been many very patiently hearing and maybe have a couple of things to also share. But do bear with me, maximum 30 seconds in case you wish to take the floor. So tell me and we will call you, or how do you want? Just
Raise hand.
raise hand. The best is raise hand and we'll keep calling you. And 30 seconds. Yeah, we have Jaiswal. Imanshu Jaiswal. Go ahead.
Yeah. Good evening, Excellency.
Good
So
evening.
actually, we were to present here. Yeah, we were here to present us on the blockchain technology Web3 infrastructure for the medical tourism for data transparency and trust. So we had a presentation ready, but as it's a 30-second, I'll make it short. So we are proposing a blockchain-based web solution for the medical tourism data transfer within both countries to provide a trustable and traceable ledger. I'll be sharing a presentation. So if Excellency can share it and give us time to another presentation to make it detailed, I'll be highly obliged, sir.
No, but Imanshu, your presentation is up and running. you just take us through your presentation, but only highlights, huh? So maybe another 30 seconds, but
Sure, sir.
glance will go. Continue.
Yeah, sure, sir. So basically, we are a Web3 blockchain development company known as Virtualite, and we are proposing a solution between both countries of a trustable ledger where all the data, which is been manually handled right now for medical tourism, can be digitally ledgerized on a blockchain technology, which will provide a traceability and trustable layer. If you see, these are the visions that we have been presenting here to as an embassy, that we can solve most of the manual issues that has been occurring into data management, and we can go with a trustable and ledger on the blockchain technology. So that is why proposing we have how the system works. So the system works with digital registration of patient medical records, identifying them, validation on blockchain technology, and automating the workflows with smart contracts and integrity of the blockchain, and providing real-time access. I'll be very quick. Providing the value that it will create is basically a trustable ledger between both countries for data. So it follows and aligns with the national priorities of both of the countries. For India, it provides Digital India Mission, Ayushman Bharat Digital Mission, and for Oman, it clears the Oman Vision 2040 and smart healthcare modernization. So these are the direct benefits to government and regulators by providing this platform. And we have proposed a 90-day pilot. So pilot one goes with one or two healthcare institutes data being transfer, and then we can go on with the complete architecture and development of the roadmap. We also provide a presentation roadmap by phase one and phase two and phase three, and as a long-term vision. So that is all we wanted to present to the embassy to propose a solution of medical tourism data on a blockchain technology. So, yes, sir.
Yeah. No, really appreciate. Thank you very much. But can you tell me one thing? Which is the existing gap that this blockchain wishes to bridge?
So basically, the major existing gap is if I ask my coordinator to go to the slide 2, that right now whatever data has been handled through any system is a manual verification process, and this manual verification process delays and inconsistencies in the medical tourism data management because most of the systems are fragmented.
No, yeah, cross-border healthcare. What kind of? Just give an example of the manual verification that it undergoes. One
So, say for
example.
example, in previous many of the meetings, people have mentioned there is a medical tourism. 10,000 people travel every year from Oman to India for medical tourism. They apply for medical visas, and they have the document be verified by different hospitals or maybe test or maybe visa processes. This all processes right now are human centric and manual processes, which are on a centralized system right. When it goes to a blockchain system, it becomes a decentralized ledger, which itself gives a trust and traceability feature. So there is a
But
gap.
Himanshu, such a system of blockchain then will have to have onboarded everybody concerned. For example, if it's a visa, then the embassy has to onboard on it. Or do you think it will be in the absence of embassy onboarding onto this blockchain, it will still function? Or who are the ones to be on the blockchain for this to be effective?
So, sir,
One
actually, the
is
data
Indian
stores on
side.
the current system. Yeah, so the data source on the current systems right now. They don't have to put the data on a new layer. It stays on the software what they're using right now. Architecture with a smart contract goes to the blockchain network for verifiable. So no organization has to onboard the data onto this technology. They just have to keep the data within their own framework, but with smarter connected to a blockchain technology.
Fair enough. We will further dig through your presentation and we'll try to understand this thing. In case we have doubt, we'll ask you. If you have some paper also on this subject, please do send because this is a novel idea which you suggested during the entire session today, to be very frank. So the application of a blockchain in the cross-border healthcare is a novelty to my mind. It's a good idea. So by all means, send any paper you may have readily available to us. We'll again populate it onto our portal and also we'll add your presentation. Thank you, all in all.
Sure, sir.
Jaiswal. Thank you very much.
Thank you so much, sir.
With that, thank you. Let's again see if anybody wishes to raise hand and take the 30 seconds of prime time before we end the session today. Just see the entire layout. Yep. Do we have any? I see none. So, okay, and now that you all been along, if you unmute your video, we'll be able to take a screenshot and celebrate this ending of today's very successful, effective session. Pratik, really appreciate you being with us all along from Sohar Port and Free Zone. He's been our valued partner, and anybody wanting to come and locate in Oman, Pratik is there, the reference point.
Thank you, Your
With that,
Excellency.
no. Thank you, Pratik. Nice to have Naresh, Rana, Abhishek, Jolita, Q-Line, Samson. Please unmute your videos if you can. Pratik Lunawala is already it's the second account, I believe. Pratik, you have two accounts.
Yeah.
If you, yeah, 2 seconds more in case you can unmute your video. Let me take Naresh Rana, Abhishek, Samson, Hakimuddin, Pratik second account, Naresh Rana. Okay, we'll make do with this. And really appreciate. It's time for me to
Yes,
say
thank you, sir. We all
to each and
attended.
every one of you. Thank you.
Thank you for giving the opportunity.
Thank you, sir.
Have a good
Thanks a
day.
lot.
Bye bye. Bye bye.
Thank you.